All right, what's up? This is Chris here. So, good morning. This happy Wednesday. So, I'm here right now at the UJA headquarters, UJA floor. We're here for hashtag Facing Gun Violence panel and conference. So, it's gonna be an all-day conference from 9 to 4. So, it started a few seconds ago by JCRC.
Good morning. Good morning, everybody.
Good morning.
If we can, we're going to start now. So if everyone can just sort of settle in. And
Sorry about
conversations
that.
will be plenty of time for talking. Well, I will ask that if anyone needs to have a conversation, some great space outside where the coffee is. It's a good place to have the conversation rather than in here. Because as I said before, the journey we're going to be on today is really a journey. It's not always going to be one that we'll be comfortable with, but it's something we really have to pay deep attention to, because it is something that is really shaking the very foundations of our society. I'd like to first introduce, for greetings, Karen Kasdan. Karen is the co-chair of the Jewish Community Relations Council of New York, and I'm Rabbi Bob Kaplan. I am the executive director of the Center for a Shared Society at JCRC. We are the Institute of Faith and Community Building division of that agency. And Karen is the co-chair of the commission, along with Josh Moskowitz, and the former and founding chair of government relations here at UJA Federation. So without further ado, Karen Kasdan.
Thank you very much, Bob. Sandy Hook, Nashville, Marjorie Stoneman Douglas, Tree of Life, Club Q, Uvalde, Nashville, from the Bronx to Staten Island, from Brooklyn to Manhattan and Queens. Headlines across the United States, including New York, struggle with a surge in crime and gun violence. The pandemic exacerbated this issue, and the need for public safety became the #1 topic on everyone's mind here in New York. Last July, when we faced an increase in gun violence here in New York, a few of us began a conversation and convened a small group from the community to listen to each other's questions, their concerns, and their community's top priorities in this ever-changing, complex, and changing landscape. We then held our first forum in December, which featured a panel of experts on the issue of gun safety and gun violence, including A.T. Mitchell, Mayor Adams' Gun Violence Task Force Chair, Andrew Edelman of Everytown for Gun Safety, and Natasha Christopher of Mothers for Safe Cities, the 67th Precinct Clergy Council, as well as Rabbi Menachem Creditor of UJA Federation, author of many writings, including Rabbis Against Gun Violence. How can we as a community collectively respond? How should we as a community respond? What can we do as responsible citizens and community leaders to discuss, convene, educate ourselves and others, and take action? Today you will hear from a myriad of New York community leaders and leading experts to address the concerns, to answer questions, and to discuss what we can do, whether in the community, whether with our service providers, whether with our government, or with each other. I would like to particularly thank Bob Kaplan, Director of Shared Society Center of the JCRC of New York, Emily Bobkin and Rachel Lissy of JCRC, Rabbi Menachem Creditor of UJA, Louisa Chafee, who is here, formerly of UJA, and now Director of the New York City Independent Budget Office, and Margot Paz of UJA for making today possible. along with countless other organizations who serve as co-sponsors, as well as our amazing group of panelists and keynote speakers. I'd also like to welcome the president of JCRC, Ben Golub, who is here in the audience, as well as our CEO of JCRC, Gideon Taylor. We also have Bronx DA Darcel Clark, who will be speaking to us at lunch, and we are thrilled that each and every one of you are here to participate. Hopefully today you will walk away with a deeper understanding of the issues facing us and what can we collectively do to change this dialogue and narrative. There is on your table, and you'll hear throughout the day, one of these where you can download so you can get not only the information of today, the bios and the agenda, but also action steps and resources going forward, which will be changing all the time. Thank you. It is now my pleasure to introduce Reverend Charles Galbraith, who does not need an introduction. He is a pastor of Clarendon Road Church, but I wanted to point out his deep commitment not only to his church, but to the betterment of the community by serving on many advisory boards and councils, from the mayor's office to the community board to SUNY Downstate to the 67th Precinct Clergy Council and more. Without further ado, Pastor Charles.
Good morning.
Good morning.
Oh, sounds like it. It's an honor and privilege to be able to share with you today. Thank you for that wonderful and generous introduction. Thank you to Rabbi Kaplan for the opportunity and invitation to the JCRC as well as the UJA for this opportunity and invitation, and for all of us who are gathered here together. As we reflect on this time concerning addressing and ending gun violence, I want to begin with a story of my own experience that started about 13 years ago at the founding of the 67th Clergy Council, also known as the God Squad. It was one of those warm summer nights where I received a call. You know those calls, not at 7 o'clock or 8 o'clock, but one of those midnight calls, that there had been a shooting and violence that had once again afflicted our community of Central Brooklyn. Jumped out of my bed, started to get myself together and get dressed to prepare to go to the street. As I was preparing and getting myself together, my wife looked at me and with puzzlement within her eyes asked, "Where are you going?" I said, "Unfortunately, there's been a shooting within our neighborhood, and I've got to go. I need to be at the scene." She responded with, I think, concern, but also with a little bit of cynicism as well. She looked at me and said, "You're a preacher. What are you going to do?" I looked back at her in that moment, still with a little bit of dizziness, being awoken from the sleep, and responded, "We're going to end gun violence." As we think and reflect on this scourge that has afflicted and affected our neighborhood and communities, I believe that we must vision with an idea, an ideal, to not just reduce gun violence, but to eliminate it. Just for the few moments I have, that just gave me a couple moments, that's a problem for a black preacher. but just the few moments I have, I want to share and reflect on the idea of a prophetic picture of the possible, visioning abolishing gun violence. I must pull from the sacred text of my tradition and some of your traditions to think about what does it look like to imagine what seems to be impossible. I think there's something significant about imagining and visioning, particularly from a faith perspective, where we're able to engage, as Walter Brueggemann talks about, this prophetic imagination that criticizes what is currently broken, but then re-energizes and imagines what has the possibility to be. Imagination is visioning. It's illustrated in Dorothy Day's Hospitality, Dietrich Bonhoeffer's Resistance, Dr. Martin Luther King Jr.'s dream, Gustavo Gutierrez's understanding of the option for the poor. Imagination is not fantasy, but rather deeply connected to the contextual reality and the environment which it is located. Fantasy is just thinking, saying words makes dreams come true. But imagination is saying these words, but also engaging in reflective praxis and action to actualize these words within reality. Let me give you some words from sacred text. In Zechariah, the 8th chapter, there is a picture of a vision of what can be that I believe is possible today. Text says, I will return to Zion and dwell in Jerusalem, when Jerusalem will be called a faithful city, the mountain of the Lord God, the holy mountain. This is what the Almighty says. Once again, women and men of ripe old age will sit in the streets in Jerusalem, each of them with a cane in a hand because of their age. The city streets will be filled with girls and boys playing there. I love that image. I love that picture of what is possible. But as I shared with you, imagination is not just wishing something to be, but rather engaging in reflective, thoughtful praxis and action to actualize it. And for that, I have to take the challenge on myself. For that means for me, and I also believe for many of us, examining purely performative practices. I'm not here to give you a sermon, just here to give a little talk. But as I look at this passage, I'm reflective of right before it. It shares about the people who are engaging in fasting, but were not really truly being connected towards the issues of justice. The command and correction that's lifted up for them is to say, administer true justice, show mercy and compassion to one another. And so I'm thankful for our gatherings of a religious experience. I'm a preacher, I'm a pastor, it's what I do. But if that is not spilling into the spaces and areas where there is violence and pain, then it simply is performative. Mm-hmm. And it must be challenged. Not only are we called to examine practices that are purely performative, but we're also called to occupy these spaces with a prophetic imagination. I love this passage because it paints a picture of a city. A city where people are gathered, a holy habitation where there are no bad neighborhoods, but simply holy ground. A place where there is longevity of life, where there are individuals who are growing in their fullness of their life. I love that image that shares of those mothers and fathers who are holding canes in their hands because they've had the opportunity to grow old. There's a gun violence march that happens every year in my neighborhood. And the first year that I marched in it, I was struck by the call of many of the young people and the chant that they lifted up. One of the chants they lifted up was this chant, "Don't shoot, I want to grow up." Don't shoot, I want to grow up. The possibility and the luxury within our cities, within our world, to grow old and to see the possibility. And then I love that last part that says, city streets filled with girls and boys playing there. An image of streets not flooded with guns and shell casings, not flooded with chalk marks or police barriers, but rather streets flooded with laughter and joy and celebration, where the smell is smoke from the grill, not smoke from the barrel of a gun. Where the shouts of joy are shouts of celebration and not terror. Where the blaring sounds are the sounds of the electric slide and the cha-cha slide. Not the sounds of blaring police sirens and stress. It's an image that we can see. That yes, we are called to our religious experiences that are deeply formative to us, but it must go beyond us to touching those connected in our world, in our society. That we occupy these space with a prophetic imagination, that we're daring to say of what can be. I remember we were meeting with some consultants who were helping us craft our message as the God Squad, the 67 Clergy Council. And they talked about the opportunity for funding and how you needed to have certain goals. And many of you know about consultants and how you have to form things in a particular way for the funding sources and the sponsors to get behind you. And they said, let's talk about this idea of gun violence. We want to reduce gun violence by this much. We want to bring it down by this much. And said, no. We're making a stand. We want to eliminate gun violence. They said, well, that doesn't play that well. Is that possible? We said, we believe it's possible. We have to believe it's possible. That our young men and young women can grow into old men and old women. That we can grow in our faith together. The last thing, always be careful when a preacher says the last thing. The last thing I have to share is this, that our imagination must also have demonstration. That it's just fantasy if it just stays within our minds, or it's words that are just lifted up during panels and speeches and reflections. But imagination with demonstration causes us to get our hands in it. Once again, looking to this text in Zechariah, 8th chapter, it declares, do not be afraid, let your hands be strong. The idea that we're called to engage in the full practice of unmaking and unlearning of violence. That we are called to do the work that people are wondering, why are you doing this work? It's because we are saying we are deeply connected, we are deeply invested, and we believe in a prophetic imagination of a place and space where there is no more violence. We offer this prophetic vision where, in the words of the prophet Isaiah, the swords shall be beat into plowshares. We offer the shared vision and the idea that we would study war no more. We offer this shared vision in the words of the psalmist that we would bring an end to the violence of the wicked and make the righteous secure. I'm confident that not just our words, but our collective, engaged, reflective practice can be embodied where we can build a city of faith where, in the words of Ray Bakke, there are no bad neighborhoods, but simply holy ground. Let's undo gun violence. Thank you.
Pastor Charles, all I can say is that I think that our souls, our minds, our hearts, our beings are lifted up, and you have put a challenge in front of us of not just saying a little bit, but we need to truly eliminate. So thank you so much for your setting the pathway of faith before us as we take our next steps in this journey that we are here to do today. And again, it's a journey. This is not a forum, folks. This is not a conference. This is a journey. This is us who have chosen to spend our time here together this morning that will allow us to take some next steps together that will be part of that grander puzzle of leadership, faith, and otherwise that will get to that holy ground, that will allow us to see what's in front of us. When we started this, we were a little, nervous. Who do we bring to the table? There are so many people out there who have such deep levels of expertise, but we wanted to make sure that this time together today will be that important to you, that informative to you, that it will allow you to take some of those next steps and walk away from here not only educated and informed, but inspired. Inspired to become part of the solution rather than be okay with the problem as it sits. And again, I want to thank the DA. She will not be joining us for lunch, however, she's unfortunately has to leave early. She's been called away by the governor. But I want to thank the DA for every day. We've developed a very close relationship every day, waking up and knowing what her responsibility is to the people of the Bronx in our city. About 30 years ago, when my beard wasn't so great and he was a very young person, Michael Dowling, then working for Governor Mario Cuomo, was asked to keynote a conference that was going to also build a movement around inclusion of healthcare with immigrant populations throughout the city. It was the first coalition that I had the honor of helping to incubate. It was called the Northern Queens Health Coalition. Michael will remember it well. And it was around the issue of immigrants in the healthcare system. It was held at the YWCA, known as the Korean Y, in Queens. It was an era when, as unfortunately an era that we're sort of in right now, when immigrants were not always seen in the best of lights. Michael Dowling came and inspired us and spoke to us and allowed us to take the next steps of getting to where we needed to be. Since then, he has built a magnificent collage of healthcare facilities throughout the New York area, and now I understand a little bit in Connecticut and up in New England too. With the Northwell Health takes care of people, and I think that's really where his heart comes from, taking care of people. Because what under his leadership, what has happened is that Northwell has taken a step to make sure that gun violence is now on the lips and the list of important issues that the Northwell is looking at from a public health perspective. Not to steal any of his thunder, I'd like to introduce Michael Dowling, the CEO of Northwell Health.
Good morning, and thank you very much for inviting me to speak for a few minutes. I do remember that meeting well in Queens. It was not an easy thing to deal with back then, but it's important in that context to remind ourselves that we're all immigrants. We all come from someplace. I'm a first-generation immigrant, but we all are the sons and daughters or relatives of immigrants, which is an important point to keep in mind all the time when the issue of immigration comes up, which we're still very, very actively involved in. I also want to say that I'm delighted to meet a lot of old friends here, and the person that I met this morning, Michael Miller, whom my first trip to Israel was with Michael Miller 35 years ago, when we spent, as part of a delegation, about 10 people, we spent over 2 weeks in Israel. Met with the Prime Minister Rabin at that time, toured all parts of Israel. I've been back a couple of times since. But Michael, great to see you. Thank you for opening my world to a whole new world back then. So wonderful to see you again. And the other thing I want to mention is to say thank you for engaging in a discussion on this issue, because it is an issue with multiple ramifications throughout society in general. And there's a lot of work to be done, and as was mentioned in the introduction, this is a long-term effort. This is something that we have to stay committed to for a long period of time, because to get to where we want to get to, it's going to take time, and it's going to take persistence, and it's going to take grit, and it's going to take courage. So what I'm going to do is basically talk a little bit about the issue at the beginning, repeat obviously some things that you already know well, but then talk a little bit about what we're doing at Northwell, both regionally and nationally on this issue. I can say that we have been one of the few organizations, healthcare organizations, nationally that has taken a major leadership role on this issue. So I'll tell you about what we're trying to do. And I do think that there is a wonderful responsibility by all the not-for-profits, could be led by this organization, to bring all the not-for-profits together around the region to develop a coalition of influence from all disparate organizations to begin to work on this as a major, major public health issue. So we all know, for example, and this is the reason we're in this country, that the US is known for having wonderful distinctive characteristics. It's the reason we all came. Democracy, opportunity, freedom, and we can recount all of the pluses about the United States and what a wonderful country it is. But we've also become distinctive for things that we should never be distinctive for. And one of them is gun violence. 40,000 people die from guns every year. 71,000 get injured by guns every year. And that number is increasing, accelerated post-COVID. There are about 400 million guns owned by Americans today. An extraordinary number. Of all the kids between the ages of 0 and 14 that die from guns in the developed world, almost 90% of them are in the United States. That is not something that you should be known for. Guns are the leading cause of death for kids and teenagers, adolescents. The second leading cause of death are automobile accidents. And the third leading cause of death is cancer. But the number one is guns. And we spend a lot of time reading about mass shootings. Just picked it up today's New York Times. There are 2 mass shootings in the last 3 days. But you know, it happens so frequently now, we don't pay an awful lot of attention. It's just another story. We quickly read it, turn the page, and move on. As we've been hardened to it. But it's important to remember that mass shootings are less than 2% of gun deaths. While it gets some attention, it's only less than 2%. It's the one-offs that occur causes the bulk of the problems, which we're very familiar with. Every weekend in New York, every weekend in any major city, every weekend in rural areas. It's not just the cities, which some people would like you to believe. So this to me is a major, major public health issue, and we have been promoting it as a public health issue because when you work in the business that I work in every day, we see the kids coming in, shot. We've had a 400% increase in our children's hospital in the number of kids coming in with gunshot injuries in the last 12 months. There is a Netflix show now that is showing. It's about Northwell. Netflix did it. It's the 3rd one they've done. It's called Emergency NYC. If you haven't seen this, I would strongly urge you to see it. It's not a commercial on Northwell, but it tells you about what goes on in the healthcare world. But a big part of that story is about one black teenager shot. And his concern, and the family's concern, when the Netflix show came out, was that if the gang saw him or recognized him as being in the show, and the fact that he got shot was a show of weakness, that they might come and kill him. And we had to deal with that. But it's not only the individual injuries that we see all the time, including one of my own staff members who was shot and killed across the street from my office in Long Island And she went to her car to put something in her car at 4 o'clock in the afternoon. And her boyfriend was waiting and put 5 bullets in her head. We see it. A family, husband and wife, comes to our pediatric hospital not too long ago to see their sick kid. They're on the floor in the ward in the pediatric facility. But there are all these kids to see their kid who was sick. They got into an argument. He pulls a gun, puts it to his wife's head. On the floor of the hospital, threatened to kill her and all her staff. Fortunately, our security are adept at this, prevented a bad situation from occurring, got to his car. He had 14 guns in his car. So you had the individual issue, who was affected by this. You have the family issues of the victim, but also the family members of the shooter. Distraught. You have the community issues. For those of you who walk around the communities out there, as the preacher just said a few moments ago, and I've been out there quite a lot, the palpable fear in those communities about what might happen. Pretty extraordinary. So it's a public health issue. So its impact is huge. We are all affected by it. This is why it's great to have a meeting like this, and there needs to be so many more. Because we have a collective responsibility to do something about it, especially those of us in some leadership positions in our various respective organizations. So my involvement and our involvement began, and I should say, by the way, before I mention this, is that my wife was in the middle of a major shooting at Beit Israel Hospital many years ago. She survived, but her boss and her boss's boss were shot. The person who did it, whom I knew, did some time. He had shown up in the hospital in one of the facilities on 14th Street with a trench coat, earplugs, Israeli Uzi, 2 handguns. Asked to see my wife, she goes to the front. He shoots the fixtures and the ceiling from above her head. Why he didn't shoot her, we don't know. But he did time, was released, and was having breakfast on the top of the World Trade Center on 9/11. So about 4.5 years ago, I was sitting at home on a Sunday evening watching and listening to some of the news again about some of the terrible things happening and the politics of it all, and saying that we in healthcare have to do something. We are the largest provider of healthcare in New York. We are the largest employer in New York State, largest private employer right now with about 85,000 employees. And therefore you have to ask yourself, when you stand in these roles, what is your responsibility? It's just not inside your own organization. I believe strongly that we have a responsibility externally to make a difference in the broader world, not just only make a difference inside our organizations, especially when you're in the healthcare business, because this is a public health issue. You affect all of the communities. What I did after that, when I was at home on Sunday, the following day, I took an ad in the New York Times. Took a full-page ad in the New York Times, basically saying that all healthcare leaders and the leaders of all healthcare organizations should take it upon themselves to lead a campaign collectively to deal with gun violence as a public health issue, highlighting the issue that it is the largest killer of kids. You know, if you stood up here and said, cancer is the #1 leading cause of death among kids, you generate activity immediately. And we do a lot with cancer in kids, but it's not cancer, it's guns. So I took an ad out. And I called around the country to many of my friends because, I've been in the business a while. pretty much know every CEO of every large healthcare organization in the United States, and I called to many of my friends from Texas to California to Mississippi, Alabama, and I could not get anybody to participate. From my good friends, they said, I agree with you. This is important. It's a horrific circumstance, but it is the third rail. It's too dangerous. Members of my board are members of the NRA. The politics of my local community is pretty drastic in this regard. So I don't want to get out there. It was frustrating, but you don't give up. Persistence makes a difference. Continuing commitment makes a difference. I ended up, as a result of this, plus other things, having to have security at my house round the clock for about 4 months. That plus the issue of the vaccine mandate, I ended up having hundreds of people in front of my home, walking up and down in front of my home with megaphones, carrying swastikas. Pictures of me, my hipless face. When I'm not at home to this day, if I stayed in the city tonight, I had to have a cop in my driveway to protect my wife. But you persist.
Mm-hmm. Yep.
You all know this.
Mm-hmm.
More than most. So we put that ad in the Times, and then we created a Center for Gun Violence Prevention and Safety inside the organization. So we have a major center inside Northwell, led by Dr. Chetan Sathya, pediatric trauma surgeon, whose first case was taking a bullet out of a 6-month-old baby, who survived but is paralyzed, who recently did a surgery on a 12-year-old girl walking to school not far from our hospital with her backpack, just going to school, drive-by shooting, gets to her hospital, saved her life, but paralyzed from the neck down. So the other thing we did, we decided to hold a national forum on gun violence every year. We held one earlier this year. This year we had about 700 people show up. We had about 2,000 people on Zoom. We bring together some of the top national leaders dealing with this issue. I work very closely with the Bloomberg Group. I work very closely with Gabby Gifford, with all of the organizations. We know them all across the region and nationally. We deal with the White House. We deal with members of Congress. Senator Chris Murphy from Connecticut is one of the leading players nationally, a fabulous, fabulous guy. If you're having a meeting at some point that is further beyond this, subsequent to this, it would be a great thing to have Chris Murphy participate. He has written a fabulous book about violence in American history. Probably the best book written about violence in American history ever written. So we did the annual forums. We do them every year. And then we decided to engage in a major awareness campaign. So we work with the local police. We work with local gun owners. We work with the schools. We work with the teachers. We do extensive education across our region. And it's interesting that when you're out there and you talk about gun violence and you focus in on the kid issue, children's issue, that you get a lot more traction. We do not deal, at least I don't, deal with the Second Amendment issue, the right to bear arms. That you don't get a lot of traction on. Mm-hmm. Some may argue that that's what you should go after, but to me, I go after it as a public health issue, focuses on kids, the effect on families, showing the cases. So we ran a major awareness campaign. we put some TV ads you may have seen our TV ads. They're run pretty consistently. Actually, we can play the ad if you have it there. Let me play the ad. And we may want to play it twice so you get the message. But then I'll explain what we're trying to get across. But this is being used on the TV on a regular basis.
Hi, thanks, parents. We just wanted to ask, and it's totally cool. There's no issue. The tiger.
And we were just wondering if he'll be locked up.
Yeah, will the tiger be locked up for the whole time?
Absolutely. We never let him out with kids around. Not even our own.
It doesn't kill to ask about unlocked guns in the house. Guns are now the leading cause of death for kids.
So that's probably the idea here, which is getting unbelievable. We've studied this, unbelievable positive receptivity. Has changed attitudes. You know, if you send your kid to a neighbor's house and your kid has an allergy to a cat, what do you ask? Is the cat in the house? Where is the cat? Why not ask the same question about guns? You remember not too long ago the case in Virginia, the 6-year-old kid who goes home, gets the gun, goes to his school, and shoots his teacher. You ask the question, where did he get the gun? The gun was definitely not locked up. Unlocked guns are a major cause of gun violence. So, this ad we make available across the country. So the other thing, now following up on what my call to all of these CEOs years ago when I got no response, we continue to push to get these people understanding. And I've spoken nationally on this. A couple of weeks ago, I was asked to speak because things are improving. Awareness is happening. People are changing their minds. You're not seeing the results out there yet, and you won't for a long time. But that doesn't mean something positive is happening. I was asked to speak to the Council of Teaching Hospitals in Chicago a month ago. These are all the deans and all the medical schools. Typically, that program is all about medical education, etc., etc., etc. They asked me to come to Chicago and speak about gun violence. And a unique, distinctive invitation by that organization that never did it before. So let me go back to the CEOs. Today, I have created a National CEO Council on Gun Violence Prevention and Safety. Today, I have 55 CEOs of the top healthcare organizations in the United States have signed on the dotted line their commitment to engage in a national awareness campaign about gun violence. 5 years ago, I couldn't get one. I got 55. Now, they're from Texas. They're from Mississippi. They're from California.
Wow.
They're from the red states and the blue states. Had a Zoom meeting with them all this week, last week. We're working out on a couple of items. We're hoping, and this will continue over the next month or two, but we have had discussions with the Ad Council. You're aware of the Ad Council, which runs massive national campaigns on unbelievably sensitive issues. Very, very good to work with. I had them present to the 55 CEOs at a Zoom meeting last week. And we're trying to see if we can engage the partnership between the CEOs of all of the big health systems. Imagine the influence of that collective group, right? On a public health issue like this. We do a campaign with the Ad Council and do a national awareness campaign on prevention and safety. And I think that you're going to see that happening. So that's one major issue. The other major issue we're dealing with is to collect a data, create a database. There is no process at the moment to collect from every single healthcare facility the data on the violence that shows up, the results of the violence that shows up in their various facilities. Imagine what that, if I can just give you the data on my health system, which is humongous, imagine if you developed a collective database from every healthcare organization in the country and you make people aware of it. So we're working on that issue. We're also working on, and we do this at Northwell, when you come into the emergency department, we do what we call universal screening. So we ask questions of people who come to the ED a lot. We ask about tobacco. We ask about health issues. We now ask about their relationship with guns, their experience with gun violence. People talk to you about this, so then we make referrals to other organizations for these people. We have screened about 20,000 people. We have an NIH grant to do this as a research entity, so I'm urging strongly, and we're getting a lot of receptivity, to have this done at every hospital and every healthcare facility across the United States. And then we're working together, the group, on workplace safety. And I wrote a piece about this recently that was published in Becker's magazine. I never thought that I would be spending tens of millions of dollars to protect my patients and my employees from people with knives and guns. So we have now in most of our hospitals, when you walk in, we have this technology that you have to walk through. It detects whether you're carrying something. It's an expensive proposition. The technology is pretty great, but behind the technology, you have to have the security. So it's very expensive. We've enhanced our security across all of our organizations, but nothing is foolproof. Yesterday, I got a call in the morning that we had a patient who was being treated in the room by an employee, and he pulls a knife. This big. And we finally, after hours, were able to get him calmed down, take the knife. How did he get the knife into the hospital? He came in through the ambulance. Now we have to figure out, how do we screen ambulances? We never had to deal with this. Never even thought we would have to deal with this. It's an unbelievably expensive proposition. That's the world we're in, unfortunately. Therefore, it's incumbent upon us to figure out, as the preacher said earlier, how to dilute it, how to change it. And you've got to take a public health approach to this, in my view. You're never going to get rid of guns, not in the politics today or in the foreseeable future. But you've got to take action, advocacy-wise and otherwise, to reduce the impact. Just imagine what we've done, for example, with automobile accidents. At one time, automobile accidents were one of the leading causes of death. So what do? Seat belts, airbags, the front of the car where the passenger is the soft leather, changing speed limits. It is no longer one of the leading causes of death. You can take other examples like smoking, drinking. So you've got to be tactical about this. Because we're in an environment that is, I find it interesting when I look at some states, they're willing to take away the books from a library, but allow people to keep their guns. We'll take your book, but here's a gun.
Mm-hmm. Yep.
Okay. And two other points I want to make. There's one other very complicated issue that we got to put our heads together to figure out how to deal with. I don't have a clear answer here, and we have to be very, very, very careful how we articulate this. And that's the relationship between mental illness and guns. We have a horrific mental health problem. If you were to ask me now, what is our biggest issue that we in Northwell are dealing with, it's the phenomenal growth of mental health. Extraordinary. 800,000 people in the New York area suffer from mental illness. We at Northwell, we are the second largest providers of mental health in New York State. And we take care of about 25,000 people a year. The population born after 1995 have the highest incidence of suicide, anxiety, and depression of any group of people ever studied. And a direct relationship between that and social media. So we have a social media problem. But let me get back to mental health. For those on the other side of this argument, they will make the claim this is a mental health issue. Now, there is a component of the people who commit crimes that have a mental health issue. But not all gun violence is mental health. So you have a gun issue, a mental health issue, and there is a crossover. But we have to be careful. We have to deal with the mental health issues. But we can't fall into the trap of assuming that all gun violence is the result of mental health issues. That is too simple. That falls right into the argument on the other side. It's not the gun. It's the crazy person with the gun. That's too simple. We have to figure out how to articulate this. We can't avoid it as healthcare people. Some people on the left would like to disregard it altogether and say we can't talk about mental health, it's all about the gun. No, that's too simple also. We have to acknowledge that we have a mental health issue and a portion of the gun issues and the gun violence is associated with mental health, but not all of it is. Only a small portion of it is. So we have to be careful how to articulate this. And lastly, I'm one that always believes in optimism. You have to believe, as the preacher said earlier, that you can get to a better place. And you go through cycles. And I always remember way back when Ralph Nader came out with his proposals on how to make automobiles safe, because they were a big killer. And he talked about airbags, and he talked about seat belts, and I remember everybody arguing, that will never work. Nobody will make cars with seat belts and airbags. Car manufacturers won't do it because it's too expensive, and if you put them in, nobody will use them. Now that's what, 30 years ago, 35 years ago? Try to buy a car today without a seat belt and an airbag. So there's hope. Because one of the things that we, you, I, and others in this field, we have to have a continuing sense of optimism that it can get better, it will get better, but only because we are persistent in our advocacy and in creating awareness and in arguing that we're better than this. The United States is better than this. When you go to other countries, and I travel, and I know you travel, you go elsewhere, people talk to you and say, what's the matter with the US? Why? Our politics is toxic. Hopefully, that will change at some point. But we have to maintain our consistency of effort. Now having most healthcare organizations involved and committed, I think is a step. Especially when I get CEOs from places that prior were afraid to put their names on something. And I actually took an ad in the Times about 4 weeks ago, and I had each of those CEOs sign, and I took a full-page ad in the Times with their signatures. Not just their names, their signatures for everybody to see. So from having nobody to having 55, and that number is growing, I see some progress. So I would say continue the discussion, continue to find ways to articulate the issue better. But I do believe by talking about gun violence as a public health issue gets you more traction. That's the tack that we're taking. We have become a national leader on this. Like on next Tuesday night, I'm meeting again with Gabby Gifford. She has been here with us. She's been a strong advocate along with a lot of others. And we've had meetings where we've had people from the White House show up, people from the Senate and the Congress show up. There's a lot of people out there that want to do the right thing. It may not appear like that each and every day when you pick up the newspaper, but there are a lot of good people out there. But we have an obligation. To me, when you're a leader of any organization, you have a special obligation and responsibility. And it's just not about to make your own organization do well. It's about to have the community do well. And so with that, I thank you for the invitation. Thank you for having me here. Stay focused and let's get work done.
Congressman Greg Meeks taught me something called, and again, traveling with him, he said you got to be consistent and persistent. Michael Dowling just sort of is a living example, as he used the word consistency. The consistent and persistent notion of how you change the world, how you go from 0 to 55, so to speak. By the way, the speed limit's now 65 in some other places. So it's just magnificent. It's just wonderful. And however, there's so much more road to go. However, putting your organization and the power of your organization and the power of your leadership is just inspirational and really tells us all, and that's really the name of the game, is we take our responsibility as leaders to take those next steps. That's really what this journey that we're on is about, taking those next steps and making sure that we get to where we need to be. One of the organizations that, and by the way, I just want to point out again, on your tables you have these QR codes as all of the agenda for the day, action steps, legislative stuff, connection to the organizers. There's also a Twitter handle for today, so if you're hearing anything that really stands out in your mind that you want to let somebody else know. Twitter is not only used for increasing the polarity in our society, the toxicity of that polarity can be used for change as well. That's sort of how we have to change the paradigm of what we're doing here. You can go on and sort of spread the message beyond just this room. One of the organizations that's out there making sure that it is literally on the front lines of that change is Vera Institute. And while you can turn again to that online space to get the biographies and go deeper into who we're going to be hearing from now, Vera Institute has just taken such a lead in making sure that, as Michael Dowling just put it, we are living in a safer society for all of us. Safer society for all of us. We hear the stories and it just makes our hearts weep, but we need a safer society for all of us. So I'd like to now introduce, to give us some more information, to take us on another step of this journey today, Daniela Gilbert.
Good morning, everyone. It's an honor to be here. My name is Daniela Gilbert, and I lead the Redefining Public Safety Initiative at the Vera Institute of Justice. As the rabbi mentioned, the Vera Institute of Justice is a leading criminal justice organization that focuses on ending mass incarceration, protecting immigrants' rights, ensuring dignity for people behind bars, and working to build safe and thriving communities. I'm honored to be here, and it's wonderful to see some familiar faces. I worked with Pastor Monrose when I worked at NYPD. Great to see you, Pastor Monrose. And you'll all be hearing from Akila Sherrills later this afternoon, which is a real treat, and you'll find out more later. I'm going to try not to steal much of his thunder. So I just want to share a little bit about my background and what brings me to this work. So I'm the granddaughter of refugees and survivors of state violence. All of my grandparents either survived the Holocaust or fled Europe to find safety in Israel and Mexico. And because of that experience, I've always been passionate about safety as a fundamental right, as well as looking specifically at the role of the state, the role of government, in either promoting safety or inhibiting safety and leveraging that power for good rather than for harm. And so as I share some remarks today, you'll hear the theme of what government can do, and of course government in the context of democracy is designed to be responsive to people. And so I really appreciate what our keynote shared around the role of a coalition of influence and the responsibility that all of us have. So I hope as I speak you can think about how the information that I'm sharing might relate to your roles. So a couple themes that you'll hear are the role of data and information in guiding policy and decision making, as well as the power of people, the people in this room, but also the people who are on the front lines of trying to address gun violence, who have survived years and decades of trauma, who have experienced criminal legal system involvement, and who are best positioned to address this issue at the front lines and require support from everyone. So just want to share a couple of data points that complement what was shared this morning. So the increase in risk of gun violence for young people is of course tragic and hugely problematic. And it's also important to recognize that the average and median ages of victims of homicide in our country are in their late 20s and early 30s. So it's really important to pay attention to these issues as they affect youth and pull at our hearts in justifiable ways. And it's also really important not to ignore and neglect the fact that these are issues that affect adults in our communities as well, and really require attention around the kinds of interventions and supports that will lead people to make safer decisions. So when we think about gun violence, it's important to recognize that the incidents that get the most attention are important, of course, but don't tell the whole story, don't tell the whole picture. So, as I was preparing for my remarks today and refreshing myself with the data, it was really striking to me to find out actually the majority of gun deaths in the US are suicides. I think that's something not a lot of people are aware of, and I think it really speaks to the challenges around mental health and trauma that were previously mentioned, and speaks to the importance of investing in prevention. And as we think about gun violence and ways to end gun violence, it's really important to make distinctions between prevention and intervention. So preventative measures are measures that focus on delivering outcomes in 5 to 15 years. Intervention focuses on immediate results. And so if we want to transform our society and end gun violence, we really need to be able to do both, right? We need to be able to walk and chew gum, as they say. So another data point that I really want to elevate is when we look at homicides, the risk of homicide is not distributed evenly. And like was mentioned earlier, mass shootings, tragic and alarming, are a small percentage of the homicides in our country. Black Americans represent the majority of gun homicide victims. Black Americans are 12 times more likely than white Americans to die by gun homicide. That is a chilling injustice and should never be forgotten when we think about what we're doing and who we're trying to support to address this issue. Community violence is an issue that is concentrated in neighborhoods, and it is experienced in a concentrated way and is not the only form of violence that cities experience, but it's important to address because of the way that it affects networks. And so what we know is there's a small number of people in communities that are at greatest risk of involvement in gun violence, at greatest risk of being shot or of shooting, and that people who are likely to be victims or likely to be suspects typically look very similar on paper. So the notion that there's bad people, there's good people, obscures the fact that there are people who are in risky situations, who have experienced a great deal of trauma, and who need support in making different decisions. So when we think about the kinds of interventions that should be built in cities, they ought to focus specifically on helping people change their behavior and make healthier and safer decisions. So I'd like to share a summary, sort of an overview of the kinds of interventions that have been effective in reducing gun violence across the country over the last few decades. And I neglected to mention that I've been doing this work for about 14 years. I began working with cities on reducing gun violence in California in 2008. And it's really heartening and hopeful, speaking of hope, to see the level of attention and discourse around the issue that there is now relative to what there was even 14 years ago. And of course, you know, when I began working on it, there have been people working on it for decades. And so I think, you know, the idea of hope is critical, and of remembering that there are the seeds of solutions and the seeds of change happening, and it's a matter of continuing to bolster and elevate those. So when I began this work, there were debates about what's the solution. Do we do street outreach? Do we focus on individual intervention? Do we rely on police? Do we rely on clergy? And the answer really is all of the above, right? We know that intuitively. Any complex problem doesn't only benefit from one solution; it benefits from an array of solutions. And so the idea of an ecosystem has emerged as a really helpful illustration of the kinds of interventions and networks that cities and communities across the country really need to try to address this issue. And so what those ecosystems look like include a variety of measures, relying both on prevention and intervention, relying on hospital-based intervention, relying on systems that look routinely at the incidence of gun violence on a weekly basis, in some cases on a daily basis, and using that information to guide intervention, to guide who gets resources. And the referrals that Michael was talking about are really exciting. And the next step and the responsibility of government, as I see it, is to look at the data that we have and affirmatively reach out, identify who benefits from the kinds of interventions that will actually address gun violence, and focus on building relationships and supporting those people, supporting their loved ones and families to make different decisions and to show that a different life is possible. So it's really important to be ambitious and to set specific goals around gun violence reduction, and for leadership of cities and in the communities where we all live to view this as an issue that's not only on the shoulders of police and not only on newly emerging resources going to community violence intervention, but a partnership that relies on every actor and every stakeholder that has a role in addressing violence. And increasingly, there's a recognition that police can't do it alone, and police have not been able to do it alone over the last many decades. And so many cities are developing new offices, commonly called offices of neighborhood safety, offices of violence prevention, that are, in the best case scenario, serving as an infrastructure for coordination of community-based intervention and to address silos in government so that there's more coordination within government as well. So those kinds of systems really benefit from engagement with residents so that they're designed in a way that's responsive to residents' priorities, and so there's a dialogue that can extend beyond political cycles and electoral cycles so that over time there's change happening in communities that can be sustained and is not politicized. So one of the challenges in addressing local level gun violence is the importance of having a quick fix and the political pressures that elected officials face around addressing issues in the near term. And all of that is very important, but it's also important to ensure that there's a continuity of focus and of progress. And the best way to ensure that is to include and be responsive to residents and to community advocates. So I want to just close by reminding each of us that we each have a role to play, and the influence that we have around helping people find employment, helping people build out their capacity to support one another. There's workforce shortages and challenges around helping professions, right? And so one of the things that I think we can do is help equip people with lived experience to have the kinds of workforce development supports that other professions do, so that people who really have a passion for it and are effective at addressing gun violence in communities have the kinds of support and infrastructure so that they don't get burned out and so that they can continue this work over the long term, and we really build out a sector of professionals who are supported and valued in the effort to reduce gun violence. Thank you.
Thank you so much. And again, we're going to continue on our journey and go a little deeper. The first panel is going to be the reason I'm introducing him just a little bit is because he's a dear friend, but it's been an inspiration to me, is Pastor Gil Monrose, the founder of 67 Precinct Clergy Council, and now the executive director of the Center for Community and Faith for Mayor Adams. He's going to be moderating our panel. It's a treat to have him with us. However, just a little change in the lineup. A number of years ago, I got to hear a speech that Dr. King gave when he installed the new Cornerstone Baptist Church in Bed-Stuy. It was originally a Moravian church and is now becoming a Baptist church. Dr. King was apologizing for leaving early. He says, God has given me the burden of being busy. God has given Pastor Monrose the burden of being busy and also working for the mayor. So the mayor asked him to do something just the other day that he has to go out and stand in for the mayor at an event today. So he'll be leaving us partway through the next panel, but we'll be joined by his colleague and fellow pastor again, Pastor Galbraith. As you heard before, he is not walking for anything in his messaging. So I'd like to call up the panel with Pastor Monrose. We have Dr. Jeffrey Brenner from JBFCS. We have Dorian Carr from JWI, Sam Levy from Everytown, and Dr. Robert Gore. Again, all of their bios are with the QR code. Please take a look at it. And just, as I say, put those seatbelts on that weren't mandatory 50 years ago. Put them on for another part of the journey.
Everybody good? They look good?
Yeah.
Everybody look good? All right, good morning, everyone. Thank you so much, Robert Bob Kaplan. Robert Bob Kaplan, definitely, when I say that someone is a mentor, it's in true statement fashion. I think he discovered me in 2008 in Brooklyn in Flatbush. And the first time that I came into this building was on a Sunday with yourself and Michael Miller. You gave me a shout out. I will never forget that. So I'm going to shout you out every time I go to some place right now. And I was part of We All Brooklyn, the first cohort in 2008. And I remember that we were at Columbia University and we're discussing how do you make the news. I know I wish I didn't take that class, but yeah. But thank you all and good morning to all of you. As he said again, my name is Gil Monrose. I'm the founder and president of the 67 Precinct Clergy Council called the God Squad, a group of pastors in the 67 Precinct of Brooklyn who decided that we wanted to do something around gun violence. The way that I got into this work was that I was at my church one day and a young man was shot and killed on the same block. And that's how I got into gun violence. There was no need. I didn't have any inkling about gun violence. I was not going on a journey. The Lord didn't come down and say, you need to go into gun violence. It met me at the church. And so ever since that time, my first funeral back then, here it is now as the national convener for clergy for Safe Cities. We have trained over 500 clergy members in urban cities across America on the clergy-led base prevention methods on gun violence. So it's good to be here. So, we all ready? All right, so give us your best shot. So what we're going to talk about today is not just about mental health, but we're going to talk about the hidden effects of gun violence. And so a lot of times that we talk about gun violence, it is there. I think that there's two types of violence in America, two types of gun violence. We can talk about the mass shooting, which is great. But if you live in New York City, I want to tell you that the deadliest precincts in New York City has been the same for the past 30 years. And why is that? It's very simple. Where did you have the lowest census return? You had the highest COVID death. After COVID-19, after we cycle out of it, where did you have the highest gun violence? It's the same place where you had the lowest census return and you had the highest death in COVID-19. You had the highest gun violence in New York City. It has been so for the past 30 years. So this is not rocket science. This is very simple. If you see a problem, you triage the problem. When we did COVID, we put together a team and we only dealt with cancer. No, we dealt with COVID. Hello, right? So if you want to deal with a problem, what do? You look at the problem, you see where the problem lies, and then you go and then you triage the problem. Is that correct? Am I fair? Anyone who's talking to me today? Anyone? Is that right? At least I have one preacher in the house. So let's talk about the hidden effects of violence. Tell us what you see from your work and how you would lead us into this discussion as we begin. Frame the evening this morning correctly so that when people hear about what we're talking about, they're clear on the violence in which we're talking about. Thank you so much.
Thank you. My name is Jeff Brenner. I'm the CEO of the Jewish Board. We're one of the largest mental health and social service agencies in New York State. We're in all 5 boroughs, serve about 45,000 New Yorkers every year. I'm a family doctor, and I spent about 20 years in Camden, New Jersey, which is right across from Philadelphia. It's was for many, many, many years running, was the poorest city in the country, and I lived there for much of that time. So both in my practice, day by day, I saw kids, adults, and delivered babies, and saw patients in a small office, and living in the city as well, had a very intimate, up-close view of this. Much like you, I got really deeply engaged in it when a Rutgers University student was shot and killed in the neighborhood, and I sort of got called by a neighbor, ran up on the scene, and ended up doing first aid and CPR on the victim, and just got, you get pulled into these things, and you get more and more deeply pulled in. There, wasn't a week that went by where I didn't take care of someone who had been beaten up, shot, or stabbed, or a family member of someone who had been beaten up, shot, and stabbed. And the thing that really jumped out to me, I ended up learning a lot about trauma and the multi-generational effects of it. But the thing that really jumped out to me was the story from many of the families of family members themselves or relatives who had been beaten up by the police and had had evidence actually planted on them falsely and had been falsely arrested, falsely convicted. And, maybe I grew up very naively, but you don't believe everything everyone tells you. And, I was sort of at first very dismissive of the stories in my own head. I didn't say anything, but I'm like, social order can't have broken down to that point. You just don't want to believe that that could be occurring, or maybe that's just one or two examples. But the stories just kept coming out, and then over time, there were a whole lot of police in Camden arrested and convicted of planting evidence and a whole variety of things. And really what was happening is it was a department in crisis and utterly out of control. And over time, I ended up learning more about policing than I ever wanted to know. Ended up as one of 2 local citizens on a local commission to reform the police department. And a whole lot of folks from New York City, from Bratton's reform of the New York Police Department, came down to, quote, fix Camden for the 7th time. We'll talk about it. Yeah. The end of the story is the Chris Christie, the governor at the time, with the collaboration of the city and county political leaders, fired the entire police department. It's never been done in America. They actually disincorporated the police department, reincorporated a new department that was a county department with a metro division, a Camden City division. So there's only one division of the county police department was Camden, and only half the officers got hired back. And crime went down, satisfaction by the community with their policing went way up. Through COVID, the city was much calmer than a lot of other places. And I guess the bottom line I would say is from all of this are two things. One is the clearance rate for crimes, for very serious crimes like homicide, was less than 18%. So that means 80% of people who committed a horrible crime in Camden got away with it. And the impact of that resulted in people arming themselves to stay safe, and the sort of escalation of conflict and sort of how horrible that is. And the second piece of this is that police departments are just organizations that have call centers called dispatch. They have motor pools, they have HR, they have rules and regulations and structure. And it all seemed kind of mysterious to me coming from the outside of all this. But as I learned more, these are just boring, failing organizations with no accountability that are running amok. And we don't need to defund them, they just need to be managed well, and they need to be regulated. And that's, the unions are running amok, the police unions are running amok, and if we really want to get a portion of all gun violence is really derived from unaccountable, poorly run police departments. And we have to develop a much more sophisticated and nuanced societal discussion about how we move that agenda forward and how we make these organizations accountable. So let me pass it over.
Yeah, you should write a book called Running Amok.
I would read it.
Coming back to some of that good stuff. Okay.
Hi everyone, my name is Doreen Karp and I'm the Director of Policy for Jewish Women International. We were originally B'nai B'rith Women, so we've been around for a little while now. And over the course of the last few decades, we really changed our focus to work on the intersection of gender-based violence, domestic violence, and gun violence. About 25 years ago, one of the members of our organization was murdered by her husband outside of the NIH, her place of work. And that really refocused us to not just talk about all of the issues, which we still focus on, that are thought of as women's issues, but really to think about violence and the impact of violence on women and in the community, in the Jewish community. Last summer, so almost a year ago now, which is crazy to think about, we created the Jewish Gun Violence Prevention Roundtable. Members are JCRC, who are here today. Menachem Creditor is a member for Rabbis Against Gun Violence, to really convene the Jewish community to take this on, to take on gun violence. I've been talking to a lot of members of the Jewish community over the last 5 or 6 years that I've been working with JWI. A lot of people think that it's not in our community. We heard that there are obviously communities that are disproportionately impacted, Black and Brown communities in our urban centers and across the country. But it happens in Jewish homes. It happens in Jewish spaces, at JCCs, obviously at our houses of worship. And so it's a Jewish issue. So first I just wanted to put that out there. I know I'm here to talk about gender-based violence and suicide and the hidden impacts of gun violence. But I want to make sure that we are acknowledging that it's our issue too. We heard about from the CEO of Northwell Health 2 experiences that he named of domestic violence. One in the pediatric unit, right, and one outside in the car, or outside the car in the garage of the hospital. So we know that this is a hidden impact that I don't think we always really acknowledge or think about. Often we think about domestic violence as something that happens outside of our purview and is hidden in our homes. But it's a huge problem, and 4.5 million women are threatened with a gun that live in our country. And when there's the presence of a gun in the home, it's 5 times more likely that that a survivor or victim will be shot and killed by their partner. Another hidden impact of violence that we don't see, which we heard named earlier, is suicide, right? So 54% of all gun violence and gun violence fatalities in our country are by suicide. And we don't think about that often. And it's really important that we center that, I think, in our conversations. We heard about the intersection of mental health and gun violence. And I think it's important to think about that the biggest intersection there is suicide, right? So we're talking about folks that have major depressive disorder or other things. And so I just want to make sure, we don't hear about that. We hear about the mass shootings. We sometimes hear about the domestic violence. We hear about child safety and accidental shootings by youth and young people, but rarely talk about suicide and how that impacts families. And we're going to talk about trauma on this panel, I believe, and want to make sure that we're centering that in our conversations as well.
Yeah, thank you.
I want to shout out Amy. You and my 2008 we are all Brooklyn fellows. All right, it's not Amy. She's here too as well. First, so good job, Bob. All right, Dr. Gore.
Good morning, everyone. My name is Rob Gore. I'm an emergency medicine physician in Brooklyn, New York, and I'm the founder of the CAVI program, which is Kings Against Violence Initiative. And CAVI is a hospital, school, and community-based violence intervention and prevention program, really focusing on reframing this entire conversation around violence and trauma. We see patients who've been injured who come to our emergency department at Kings County Hospital. I actually work very closely with Pastor Gill and Amy Allen Bogan's, former organization that she still is connected to. That's the Cure Violence Program, Neighbors in Action, formerly the Crown Heights Mediation Center. But in our hospital program, we work with people who've been patients, and in our hospital at Kings County, we see over 300 clients per year. I do want to kind of change the scope a little bit. There's a lot of talk about gun violence, but I've been an emergency physician for over 20 years, and all of my training and work has been in places that have been underdeveloped and underfunded and underserved. I did my residency training at Cook County Hospital in Chicago, and I came back to Brooklyn and been practicing in Kings County for almost 17 years, which is across the street from my elementary school, which happens to be situated in a neighborhood and in a community
2 blocks from my church.
2 blocks from the church. Pastor Glenn and I have been having this conversation for close to 20 years about violence prevention in the community. But the reason why I say I want to change the scope a little bit is because there's always this conversation about gun violence, gun violence, gun violence. And from my perspective, it's really trauma. One of my very close friends and mentees was stabbed to death. Does that mean that his death was in vain? No, it just means that's another aspect of trauma. And trauma itself is something that we consider based on an injury due to some sort of external force, but we know that trauma is much more than just this physical process. It's a mental process that's brought on by both physical and psychosocial stressors, which impacted by everything from poverty, education, or anything we refer to as social determinants of health. And so I think it's important that we do focus on gun violence as a specific section, but really pay attention to the larger umbrella about trauma, because if we don't, we wind up missing things. If you look at, homicide itself, not gun violence, but homicide itself is the #1 cause of death for Black men ages 15 to 34. Not suicide, not accidental injury, which just as other populations. We're talking about death because of someone's intention, whether it's due to blunt trauma, whether it's due to some other form of penetrating trauma, a knife, razor blade, you name it.
Could you repeat that again? That's the leading cause of?
Homicide is the #1 cause of death for Black men ages 15 to 34. And if you look at the CDC's chart, it's actually up to 44, but if you break it down a little bit, it's really down to 34. It's the #2 cause of death for Latinx males ages 15 to 34. So this is intentional trauma. But if you break down the risk factors for who are the patients and then who are the perpetrators, and even just break it down even further and just kind of take it over to the realm of mass shootings, all the same things. Having easy access to weapons, doing poorly in school, poor social support systems, mental health issues, gang involvement. It's all very much the same thing. But I bring up these risk factors and paying attention to a lot of psychosocial issues, even taking it up to another space, the adverse childhood experiences, different forms of physical and emotional abuse, having a relative who's been incarcerated in the home. These are all things that are contributing factors. And because we all pay attention to the sexy stuff, which is there's a shooting that's taking place, there's a shooting that takes place, which is important as I forgot our young speaker who spoke from the Vera Institute. but there's much more. That's the intervention part. The preventative part is the long-term process that we need to garner more support from, which is why having this multidisciplinary team from our clergy, from our community-based organizations, from our brothers and sisters from the Jewish community in Crown Heights and beyond. I see a Muslim brother here, but having a really comprehensive approach, incorporating this biopsychosocial attempt to engage and transform healthcare. This is how this winds up taking place. The transformative elements that are essential for community overall health and well-being have to be multidisciplinary. They can't just focus on the intervention, but looking at the prevention. And the prevention is improving the qualities of education, bringing in funding to make sure that centers stay open, making sure that there's adequate healthcare access. It's not just one thing. We like to make it one thing, but it's really all the same thing. My patients, deal with HIV. I had a patient that I took care of was it yesterday? I'm having a brain fart. I have a 2-year-old, so I don't sleep very well. But I had a patient on Monday morning who was a sign out. He was undomiciled and was staying in the shelter and was supposed to get a COVID test to be cleared to go back. Once he got his test back, it was negative. He said, I can't go back to the shelter. I was like, why can't you? He said, these people are trying to kill me. I'm like, what do you mean they're trying to kill you? He said, I have gang affiliations. And I look at his chain, and he has an M16 chain around his neck, and he's got tattooed teardrops. He's also paranoid schizophrenia. HIV, COVID clearance, undomiciled, a victim of violence, perpetrator of violence. He has all of these different things wrapped up into one person. So you can't avoid targeting one issue without really engaging in the others. And so I'll pass the mic. And, thank you.
Yeah, we have a lot to say. I'm not sure what time is lunch, but we might have dinner.
Good morning, everyone. You hear me? Okay. My name is Sam Levy. I'm the Regional Legal Director at Everytown for Gun Safety. We're America's largest gun violence prevention organization, an organization that encompasses policy and legal advocacy, research, survivor supports, volunteers in all 50 states. You might have seen the Red Moms Demand Action shirts with us.
Yeah.
So my work is, I'm part of the legal and policy team. I'm the guy, unfortunately, who has to think about the Second Amendment. We'll come back to that. But as everyone just said so beautifully, we're a nation of survivors, right? Survivor doesn't mean you got shot and you've got scars and you survived, you're paralyzed, you're hurt. Trauma is everywhere, right? If ever you ask around the room, people are going to know. People are going to know victims. People are going to be proximate to violence, and it's pervasive. It's everywhere. And gun violence is one iteration of that. And to think of it as a true public health problem is to think of it as a problem like anything else, how viruses spread, how COVID spreads, right? There are determinants. There are things that you can understand if you truly stop and understand the data and put it all together. And the work that we do largely, and that I do for the organization, is to try to seek out those data-driven solutions to work on the policy aspects of it, right? This is very much a problem of governance, a problem of an industry that makes billions and billions of dollars a year by flooding the streets with firearms that are trafficked and used and turn up at all the same crime scenes in all the same cities, and continue to act with impunity. But really what it's trying to do is unpack those policy solutions, think about ways to prevent access, right, from people who are at greatest risks, domestic abusers, people in crisis. And I should say, none of those solutions exist to the exclusion of any other. I think one of the most crucial parts of having a convening like this is understanding that all that work is vital, right? It's not all going to get done at the State House, it's not going to get done at the Governor's Mansion, but that work matters. So too does the street outreach and hospital-based violence intervention programs and centering communities where you have authentic, people who suffer this trauma, who understand the import of it, who are stepping up as you all have to do that work and lift up those communities. And I'm honored to be here for this conversation and to be part of that conversation here in New York and across the country.
All right, thank you so much. All right, so you've heard a lot. Could someone stand to repeat everything that was said so that you're clear? But this is very important. I mean, if you look at this paper that you have on your desk on the table, I had so many corrections to all of the statement that was made. Number one, if you go to the back, gun violence in New York ranks 47th in the rate of gun violence among 50 states. These rates does not happen by mistake and allowed you to having the second strongest gun laws in the country behind California. Half truth. It is because of what you have seen today. Clergy working together with anti-gun violence groups, with people who are helping social programs. Those of you I want to say, I have a lot to say, but I have to leave soon. I want to say to you as well, when you listen to everything that have been said, those of you who have the ability to fund organizations who is doing work outside of what you would normally see, if you have someone again who have an application that is totally that look just like the young man that you mentioned, if an application looks like that, not like me, like that, in terms of all the things that you're seeing, these are the groups that you need to fund. Why? Because these are the people that is closest to the problem. And so what we have to do in this conversation too as well, we're thinking through the issues of domestic violence. So to help gun violence work, it takes a different level of support for different situations that we have. Domestic violence. You talk about helping police become better departments, helping again individuals with healthcare, and also to working on laws that can really make a difference and make a change in our communities, right? So those are some of the things that as we work. So when we talk about trauma, I think that all of us have been traumatized today, in the sense that we're hearing stories, we're secondhand traumatized. Clergy, you're traumatized. Doctors, you're traumatized. Those of you in the boardrooms are traumatized. If you look at all the trauma that we face, how do we deal with trauma in a positive way that help reduce the violence, and even ourselves, how do we use our trauma for positive to reduce the violence that we see? Now, if we're going through the line and at 11 o'clock, I'm going to stop and say I'm gone, and then you keep on going, okay? All right, thank you so much.
Before Secretary is going to leave, I'm not going to get a chance to do the transition right. So, Pastor Charles will step in. We were going to end, because we started a little bit late, we're going to end at noon. We're cutting in on your lunch a little bit, but as Pastor has said, you get a lot to say, and we got a lot to hear.
Right. So, is there any time for question and answer?
Yeah, sure.
Okay, because let me do this really quickly. Let's take some questions. Any question based on what was said here, so that I can get my whole panel in by 11? Any questions? Go right ahead.
Good morning.
Good morning.
I was invited here because I'm president of a synagogue. So I'm sensitive to security and what security costs for the synagogue. But I came today because May 3rd is the birthday of my husband who was killed by gun violence 20 years ago in Bushwick. And so what I haven't heard anybody talk about, although there was a quick mention to gangs, is also drug problems. And I think that, at least at that time, in our neighborhood, Knickerbocker Avenue, lots of people know it was gangs, but drugs and control, and the inability of the police to get people to support. It was a Saturday afternoon. We know people know it was never a solved crime. And so I guess my question to the panel, for not being succinct, I apologize. But my question to the panel is, where does police, drugs, and community awareness come into our challenges?
Yeah. I'm sorry for your loss as well.
Thank you.
My condolences to you and your family on this very auspicious day for you. I grew up in pre-gentrified Brooklyn. I went to junior high school on Myrtle Avenue in Knickerbocker, right around the corner from where the incident took place. And I started carrying razor blades when I was 10, 11 years old because of being jumped and mugged around that area in downtown Brooklyn. As a person of color, as a black male, I've been taught to fear police. I've had run-ins with the police since I can remember. I was always taught that you have to be careful around the police because they're going to assume that you're somebody else. They're going to assume that you're not who you say you are because you look older than you are. So my engagement with the police and some of our other members up here on the panel, Pastor Gill has a very different relationship because of the 67th Clergy Council, and they've been doing a lot of mediation work with law enforcement. I think the number one thing that can be done is augmenting levels of support. Why do people use drugs? People use drugs because they're looking for some sort of self-medication to mask the hurt and trauma. My brother's an IV drug user and has been hospitalized and in and out of institutions because of IV drug use. And he's had a lot of hardcore pain and trauma that has existed. the role of the church, and Pastor Gill and I had a conversation about this very over a decade ago, which makes me feel a little older. But what is the role of the church and religious institutions? Religious institutions are very close to the communities. People are dealing with a lot of hurt, but people coming from many spaces aren't as comfortable going to formalized counseling and therapy. We've been taught to fear the medical systems, and so religious-based institutions incorporating pastoral counseling is probably one of the easiest things that can be implemented. Now, you're also going to be dealing with a vulnerable population that not everyone at your respective institutions is comfortable with speaking with. So having members of other members in the community who are more comfortable to join and have this multidisciplinary team may be a start. Don't focus on the drugs. Don't focus on the violence. Focus on augmenting the support. That's the key, because if you don't have that support, you can talk about drug interventions all you want, you can talk about violence prevention all you want, but if you don't have basic needs of support, food, clothing, shelter, security, and security, not even just talking about physical security in terms of arming yourself, we're talking about mental security. All this stuff is going to be a moot point, and we're going to keep running around in circles. So augmenting places with comprehensive support, multidisciplinary teams, having somebody who may understand drug treatment, I think would be a very powerful thing as well. But utilizing pastoral counseling services, utilizing community mediators as a way. If you've got a group of elders from your synagogue and sat around and had members of the community who have been dealing with trauma and just talk to them, it's technically not. It's technically group therapy, but you don't have to call it therapy. It's really paying attention to what people have to say and hearing them first and getting firsthand what they might need.
Yeah, everyone will take some. Yeah. And I'd say, I think, again, thinking about the moment of tragedy, right? You see it on the news, you see it, but it's about prevention, right? It's about looking backwards. It's how do you build communities that are truly safer, that are supported, that people don't feel the kind of desperation where they're driven to that kind of violent act. And to your point, how those communities view police is central, right? Police violence is gun violence, including in places like New York. There are real concerns in those communities with distrust that are well founded. Again, these are communities that are often over policed, that have it comes from an honest place. And so part of the work and part of the reason that it actually is doubly counterproductive, because these officers want to keep those communities safe too. Nobody wants to live in fear. Nobody wants to feel unsafe in their community. But building that trust is vital, right? How do you reach out and connect authentically to make sure that you have communities that are willing to reach out and speak out when they see warning signs, when they know of something, when they could be taking action to prevent it, and work in partnership with a department that treats communities with respect, that really does engage with them in a meaningful way to help prevent these things before they happen.
Yeah, thank you. We're going to have more discussion. You can chime into it as well, Dorian, and Jeff, you can do so as well. I'm out of here.
Welcome to the panel.
Good to be here. So as we first greetings everybody, and thank you for the reflections and engagement we've had already. We'll talk about trauma in a moment. I know Pastor Gill did open it up for a few questions, so we'll do that and then come back to our reflection in this moment. So any other questions? I see it on our brother queue.
Good morning, everybody.
Good morning.
My name is Sidko. I'm from the South Bronx.
Can you speak up?
Can't hear you.
Louder.
Give another microphone. Sorry. Can everybody hear me now?
Well, wait for the mic.
Good morning, everybody. My name is Sidko. I'm the parent coordinator for CS50 department in the South Bronx. I hear sharing stories with everybody because I don't want to make the room more sadder. I'm a victim of all those three things that you guys have mentioned in the South Bronx. My brother got stabbed in the chest 2016. My cousin got shot in the chest 2016. My cousin got shot in the chest 2018. I think roughly 55 days ago, my cousin shot himself as a suicide. 21 years old. So I'm just here to just represent the South Bronx. It's been, record as one of the high victim of suicide and gun violence and drug, a lot of drug. Every block I have like 3 smoke shop in my neighborhood. So I've been there for 15 years. So trauma, yeah, I understand you very well. I'm trying. um, I just wanted to know this room seemed to have, of course, a lot of resources. I just wanted to know what you guys are doing on that side of the South Bronx because I'm involved a lot in a lot of leadership meetings. In obviously work for the DOE, so we know a lot, but it's like we're not heavy on gun violence. And I would just like to hear from you guys if you guys are thinking about us out there.
I guess as one of the violence intervention programs in the room, we don't have programming in the South Bronx with our institution, but there are some our partners who work in the South Bronx. There's SOS, which has actually grown out of the Crown Heights Mediation Center. Their location is in the South Bronx, and that's headed by Sister Ife Charles. Amy, is Ife still actually just stepped out? Ife Charles is a major force out of the South Bronx. There's also at Lincoln Hospital, which is, I'm not sure how far that's away from you, Brother James Dobbins, we call Jimbo. Jimbo heads Guns Down, Life Up, which is another program that's based out of Lincoln Hospital, providing violence intervention and prevention, not just with patients in the emergency department, but supportive programs for young people in the community of the South Bronx. There are a whole host of others, and the good news is that we've really helped augment a movement. But there aren't as many visible partnerships with some of the local schools. And so I think that might be something to touch base with. If you go on, I forgot the website, but if you just Google SOS, which is Save Our Streets, in their South Bronx location, touch base with Ife Charles and some of their team members or James Dobbins with Guns Down, Life Up. That might be a great support system for you.
Add something real quick. Sorry to interrupt. So, my name is Carlos Torres. I'm the crime prevention coordinator at the Bronx District Attorney's Office. Prior to me working for the DA's office, I used to work over at SOS Bronx. I know Jimbo. So, long story short, you work in the South Bronx, live in the South Bronx, also work in the South Bronx. I can definitely connect you with the 5 Cure Violence organizations. I know for Guns Down Life, for example, they're having gun violence youth employment program. Our office is also going to be doing the youth summit, so he has my business card. Let's talk. Anybody has any questions in regards to the South Bronx? I'm your man.
I want to just talk for a moment about access to mental health outpatient therapy in New York. We take care of about 15,000 New Yorkers every year, about 250,000 counseling visits, and so that's good news, right? And the stigma to getting outpatient therapy has gone down. So there's more and more norming across society that it's okay to go and get therapy. The negative side of the story is we have a waiting list that's more than 2,000 people. So New Yorkers are calling for help, and we don't have enough services to provide. The bottleneck for that are social workers. It's qualified, licensed mental health therapists who want to work for New York agencies. So all over the city right now, there's a lack of social workers and lack of licensed mental health counselors. We're competing. So you can go and be a private therapist and make $200 an hour. You could go and work for one of these startups that are online and make a lot more than all of the agencies in New York that are able to pay. So that's a real struggle. So that's the struggle. Let's talk about a positive piece of all this. All of our services used to be in person, and we had offices all over the city, and we had a very high no-show rate. People get out of bed and, really don't want to, don't necessarily want to show up to their counseling appointment. 70 to 90% of our services now are online. That's amazing. And that's a real pivot. And the city, state, and federal government are now allowing us legally to provide therapy and psychiatry services online. So that's great news. That means that if you're a victim of violence, you're anxious to go outside, you now don't have to leave your home. You can get services in the safety of your home. So there's a good news story to all this and a bad news story to this. And hopefully over time, our payment rates catch up and we're able to pay social workers what they deserve to be paid. And we're able to catch up on some of this backlog going forward.
As a former social work intern at JBFCS, I can attest to the challenges of social work and the important work that it holds in the city and across the country. I just wanted to lift up. We've heard it in bits and pieces, but I just want to really centralize that most perpetrators of violence, whether it be gun violence or other forms of gun violence, are victims, survivors themselves, right? Whether we're talking about family violence, so domestic abusers who witnessed interpersonal violence in their homes when they were young, child witnesses, or actually had harm perpetrated onto them, or we're talking about in these communities, right? And growing up with the sirens, the police force, seeing their friends killed, and what it means then, right, to be perpetrating that violence. We heard about the young man that had the teardrops, but also was obviously a victim himself. And so when I heard the story of your husband who was murdered, I was thinking, as a former social worker, like the individualized part of that, like who was that perpetrator of violence? What led them to take that to make that terrible decision and an act of violence? And most likely, if they were drug use, all the things, right? Like they were experiencing trauma themselves and then perpetrated it onto you, your family, your community, our community. So just want to really, people are their full selves, right? And we have good parts and bad parts to us and what makes us perpetrate harm, and the communal impact of that. And also as a policy person, right, like all of the things that we can do to support folks to find other ways of healing, or find ways of healing before they're perpetrating violence. We're about education, housing, mental health services, like healthcare access, like all of the things that we think about when we're not thinking about in the gun violence debate. We think about policies, right? We think about like background checks. We think about extremist protection orders. We think about banning assault weapons, right? But for most of us in this room, we're not thinking about housing insecurity, which is, and so I think we have to be expansive in how we're thinking about prevention and response to this problem.
Yeah, and it brings into focus, I think, the intersection of what we talked about earlier, which is mental health and something bigger, right? Mental health I'm not a doctor, people here should speak to it, but it's a defined term, right? It means you have a diagnosable mental illness, right? That is not the driver of violence broadly or gun violence. People with severe mental illness are more likely to be victimized than they are to be perpetrators of violence. But we're a society that is suffering nonetheless, right? We are people who are increasingly isolated in many respects. COVID didn't help. There was mention of social media. Like there are pieces that are about how we treat one another, how we interact, how we lift ourselves up, how we support each other, how we support ourselves that are wanting, I think, in ways that Dr. Moore mentioned, everyone mentioned, like those types of resources aren't mental health per se. There's something about our social welfare, about how we connect, and those are the things that when they are lacking, I think, make it easier, set the stage for the kind of violence that we see.
Regarding mental health, I think we just have a lot of undiagnosed mental health in our respective communities. You have somebody that's witnessed a trauma or experienced a trauma, it's normal to have an acute stress response, and that can last anywhere from 0 to 3 days. Those symptoms, and that's like headache, nausea, vomiting, heart palpitations, just feeling stressed, the sense of impending doom. From 3 days to 30 days, that's an acute stress disorder. Many of our patients and people in our communities, even our own family members, will go through those symptoms. And those, again, same kind of symptoms based on the same triggering event. If those symptoms last beyond 30 days, that's PTSD, based on that same triggering event. So if we analyze a lot of the people we've come in contact with, you go, wow, I know people who have all three of those. But then on top of that, you have something else that's been introduced. They can have pre-existing PTSD and a new acute stress response because of some trigger coming in contact with police. And so that just increases all these things until the person explodes. So mental illness and mental health challenges, we all have different symptoms related to these things, but once it comes down and has an impact on the way you carry out your day-to-day life and responsibilities, going to work, taking care of your family members, going to school, just getting up to eat. When those things are impacted, that's when it becomes pathologic. So we have to. I know people like to say, "Oh, there's no mental illness tied to homicide," or it's a small component. It's a lot larger than we like to see, and it's mental illness is hidden. It's not like when you have a physical manifestation of a disease, and you can say, "Oh, wow, that person has a cancerous growth on their skin. That person has a broken leg. I can see how they're walking with a limp." There are a lot of things that people have been trained, particularly people coming from marginalized spaces, because we're taught to hold your head up. Don't make a fuss. If you say something, then people are going to hold it against you, and then you're not going to be in a position to take care of yourself. So there's a lot of hidden mental health issues and challenges, and so I want to make sure that we don't say, "Oh, it's not as big of an issue as it is," because probably 90% of the patients that I take care of with random things in the Central Brooklyn community have some sort of underlying mental health issue. It just hasn't been diagnosed yet.
Thank you for those reflections and those insights. I also have to say this as the husband of a social worker. I really do appreciate the work and the frame of approaching it from a holistic framework of ideas and perspectives. I wanted to also note, I'm not Pastor Monroe's, but I want to kind of flow in the same vein, in the sense that there's something unique about this panel because you're coming to it from an interdisciplinary perspective of where you're addressing, and we're addressing and connecting and seeking to serve those who are coming with the intersectional framework of multiple things taking place at the same time. For those of us who are practitioners, for those who are in this room, how do you develop these partnerships, and how do you recognize when you need to go outside of your particular field to get assistance and direction?
I've had to go out in my field for most of my career. Again, most of my mentors were in other states and other cities because there weren't many physicians of color that you can kind of go to. So you're just happy to see one, whether they were in your field or not. With violence intervention, again, Pastor Gill and some other people in this room have been doing this work for close to 20 years, and we were reprimanded. We were pushed away. People would like to say, "Oh, this is kind of cool that you're doing, but we're not going to support you." And so we've always had to go outside of the environment. Medical professionals, if you look at this business itself and marketing, if you're pushing any sort of device, the medical community are usually late adapters to anything technology. That's why we still, in some places that I'm sure you're very familiar with, and I'm sure you, on a policy front, I'm sure you're just as familiar. If you look at how many paper records that people still keep in 2023, you go, "Oh wow, okay, how come people haven't adapted to things?" So this is the story of what we do. Having a list of helpful people. It doesn't matter if they're in your respective space. The goal is to get things done, and getting things done, you have to have some sort of support, and to really develop a coalition. So having conversations with people from the clergy. If you have a like-minded person who's interested in this stuff, it's like, cool. I'm just happy to have somebody who agrees with some of the things that I'm saying. You might have somebody in education doing the same thing. Partner together. Our violence intervention program, preventative program, our first programs were launched in the New York City public schools because I got a lot of pushback and slack from my own institution. I work at a hospital that's been dedicated to taking care of people's lives to help save them, but we couldn't get support for over 6-7 years. And I wound up doing it grassroots at first and took it to the schools just to make things done. My father's also an activist and met Dr. King as a high school kid and was mentored by C.T. Vivian. So change and creating change is very important to just our family. But you have to go to like-minded individuals, and who cares if they're not in your respective field? If they have an interest, if they have some connections, build on that stuff, create a coalition, and continue to build. Engineering design process teaches us to think that we have a problem, you identify a problem, come up with a potential, brainstorm a couple of different problems, Take a prototype from that particular those things that you brainstorm, then execute. Test that prototype, and you go back and see what have we done, what worked, what didn't work, and how do we go back and do it better, stronger, and more efficiently the next time. It's a cycle. But if you keep thinking that I have to stay within my respective lane, within my space, you're going to miss out on a lot of things. One of my students was an engineer, and he taught me about engineering design process. I was trying to create something like that. And he was like, "Why are you trying to create something that already exists? Look at this." And I use that as a prototype for not being hindered by mistakes. This is engineers, and I'm not sure if there are any engineers in this room. This is how they think. How do you do it better, stronger, faster, more efficiently? That's almost a mantra that they take on. So who cares if it's not somebody in your respective space? If they're a willing participant, that's somebody that you can go with. As long as they're honorable, then you can go with that person and work with them.
Yeah, and I think a lot of it is the willingness to evolve yourself, right? There are, from my experience, I've been in every town almost 7 years. It started as a project in Mayor Bloomberg's City Hall as really a political and a local organizing tool for mayors to do something about, it's called Mayors Against Illegal Guns. In the time, just since I've gotten there, our mission has stayed the same, but we've evolved in ways that are vital, right? We didn't have a community safety initiatives team when I started, and we do now, right? Whose whole job is lifting up and partnering with and identifying and supporting community-focused solutions, right? Violence intervention. We have a survivors team whose whole job is lifting up survivors and their families and giving them resources they need, and again, making connections, right? We're not that big an organization, but the work is to do the best you can in the space you can, right? I'm pretty good at writing bills, I can say without pride at this point, but it doesn't matter that much if they're not fully and fairly enforced, right? So when it comes time to do that, I want to talk to law enforcement. I want to talk to the Office of Gun Violence Prevention about do people understand that this law exists, right? That work matters, but if it doesn't go out the door and people don't know what a red flag order is or how to go get it when they see someone who's in crisis, then the value's not there. So a lot of it is, and again, there's this question of, you saw the ad from Northwell, there's a stigma largely around talking about a lot of this stuff. It's taboo for some reason, and I work in spaces, there are states that pass laws to prevent doctors from asking about guns. It's so deeply backwards, but it's a reality because everything that's done on one side of this preposterous polarized moment has to be met with counter response. So you can't, of course, it makes all the sense in the world if you're a pediatrician to ask if there are unsecured firearms in the house because firearms are a leading cause of death for children. School shootings are driven by guns that are obtained from homes or friends' homes that are unsecured. It's not rocket science. We know how these things happen, and so you have to drive solutions that way. But that's the education piece. That's the reaching out and saying here's the understanding. Here's our website has tons of cool stuff. Go check it out. If you want to know more about the problem, the data's there. If you want to know about the solutions are there. And knowing that you have partners like the people in this room who are willing to lift up that message and can offer their services. Right? Again, where my expertise stops, somebody else's begins, and it takes everyone working in collaboration.
And shout out to every town. I mean, they are one of the biggest leaders, right, of this gun violence prevention movement. And JWI, I sit on an interfaith advisory council that they created a few years ago, right? So they're engaging faith communities. A few years ago, they brought me and a big group of domestic violence policy experts to talk with their researchers. And the researchers go to conferences on domestic violence. So they're everywhere, right? They realize, and a lot of movement leaders, that they can be experts in certain things, but not in everything, right? And in the domestic violence space, when we were working on closing the boyfriend loophole, which allows perpetrators of dating violence who were convicted to have firearms federally, we had to engage, of course, the domestic violence community to get them on board, but we had to get every town on board, and we had to create talking points that were, Gabby Giffords and all the other organizations, and then the chiefs of police had to get on board because responding to domestic violence incidents has the greatest fatality for them, and really making sure that the tent is big, right? I think coming together where you can is incredibly important in forming these coalitions and authentic relationships, right? Really where you are in support of each other and have a dialogue back and forth, not where you're using individuals or organizations, but really creating those relationships is key.
I just want to talk a sec about this collaboration point. I think it's really critical. I was so excited by my collaborations with the mental health field, with social workers, that I joined the field. So I'm a family doc, and now work all day long with folks in the mental health field and social work field. One of the reasons I got so excited about it was what you mentioned earlier about adverse childhood experiences and our knowledge about trauma. There's just a growing body of really high quality research in the mental health and social service field that enables us to have impacts on people that were unimaginable previously. So in many ways, I think the public has often thought of mental health and social services as a kind of a black box, and we throw resources, we throw money in, but we don't really know what the outcomes are. That's not true anymore. The same rigor that we use to test drugs, randomized controlled trials, and all the science have now been applied to the field of mental health and social services. One of the best examples I have of that is if you turn the clock back 30 years, 70,000 kids a year in New York City were taken away from their families by the foster care system. And that's tragic. It's tragic for the family, and tragic for the kids, and the city didn't have enough places to put all those kids. And if there's any group of kids that were going to go on to either be victims or perpetrators, it was that group. Now the city takes about 7,000 kids away a year. That's amazing. That's an incredible success story. It's probably one of the greatest achievements of the Bloomberg administration. The way they did that is the application of 4 mental health evidence-based models that were rigorously tested and developed. And we are vendors to the city, and we run those 4 models, and other agencies do as well. And our teams go in and work with incredibly at-risk families and keep the family together. And they work with the kids and the parents to learn new parenting skills, new approaches, how to adapt and cope with trauma, all of these different things. When the clock goes forward 30 years from now, that will end up being the critical linchpin in the future of New York to prevent violence, because if those are the crucibles where this violence starts, and this is breaking that cycle right in the house. Our teams go right in and sit with the families and talk about why they're yelling at each other and what they can do to change that. We take referrals from those programs, not just if you call and make one of those anonymous calls that you think a kid is being abused and neglected, but families themselves can call and refer themselves with no stigma attached. Pastors can give them the phone number. Pastors can call. So we take direct community referrals as well. And all of the organizations that run these models do as well. So I think it's a hopeful note of, collaboration really does make a difference, really does mean something.
Thank you for sharing that, and thank you for even that specific example of what we're sharing, because I think that gets to the next question. But let me just speak into this as well. For me, serving as a faith leader and a pastor in Central Brooklyn, East Flatbush, several things that you've already lifted up have come to be true as part of our community. The reality of folks being more open towards conversations concerning mental health has been present, not necessarily many times in the healthcare providers, but with us as clergy. That they will come. And so what's been helpful for me is I know what I can do, and I also know my limitations. That I can offer pastoral counseling, but because I'm married to a clinical social worker, I also know that there are limitations in regards to my capability and capacity and insight. And so having trusted individuals who we can refer to, who can actually, we've been working and trying to do this where they can come meet in those faith spaces, because sometimes even the transition from the faith space to the institution can be a bit challenging. We see a drop-off rate in regards to folks following through. It's helpful to be able to work and serve on the board with SUNY Downstate, to be able to see when a situation happens, when there's a crisis moment within a family, to be able to have access and be present in that space, as well as working with other organizations, clergy organizations, as Pastor Monroe's shared with concerning legislation as well as advocacy, to recognize and realize we're not just addressing the immediacy of it, but also looking what are the causalities and effects that are lifting it up. So with that, listen, you already know, you heard me speak before. I'm coming from a patient perspective, so I'm going to ask this question for you guys. What does it look like for, first, what is in your respective fields and areas, what does healing look like, and what does wholeness look like? I think it's a good question because I hear you reading.
Healing. Ooh, that's man. I gotta think about it. Healing itself. Almost requires the absence of a disease process, and that can get an individual to a point of functionality. Wholeness is a lot more comprehensive. That's a state of balance. And if you're looking at balance, it's like I look at the body itself almost as a scaffold. You can have a scaffold that's up. That means it exists, but if that scaffold is a little bit off balance, you start adding more and more weight to it, it's going to collapse. And that's almost like what we call allostatic load. And allostatic load is really pathologic. That means your body can no longer respond and really tolerate these states of stress. So looking at wholeness itself is really not just is moving beyond healing from a disease process, but you alluded to something a little bit earlier, being adaptable to situations, to adverse circumstances and conditions. I think that is the goal. Not resilience, but adaptability and transformation and evolution.
It's a great question, by the way. So there's individual healing, right? There is, a lot of. I think of this thing as a broad scope. Like I look at statewide impacts of things, of data of aggregates, right? But obviously these are people, right? These are individual traumas. This are their families. Some of that is just centering that, right? It came up earlier. You flip the newspaper page and there's a mass shooting. Like if we ever, and I talked about this in the people that I work with, some of whom are truly, social workers doing survivor-facing work. I don't do that work. I get the pleasure of meeting them from time to time, but that's not my day-to-day. And we have these calls, and we deal with rapid response, and we deal with tragedies every day, because sadly they happen every day. If you stopped and dwelled in that space, you'd fall over, right? Like humanity requires you to have some kind of ability to compartmentalize those things, to process it in a way, to grieve it, hopefully in a way that's healthy, but you can't live in that, right? But you have to be able to honor that enough and to give those individuals the space and the support they need to grieve it, to process it, and to move forward in a way that's healthy. And the collective, I think, the wholeness question is, what gun violence is so different to every community, right? What it means to be in central Brooklyn or the South Bronx is very different from what it means to be in Syracuse or Oneonta, where gun violence is an older white male suicide problem, right? It's not a focused, small number of offenders, city gun violence, everyday problem, right? And the problem is, in part, that polarization has been weaponized in such a way that the two ends are fighting each other, when in fact the problem is unitary, right? The problem, if you understood it well, is that there's no separation between you and I. We experience it differently, right? It looks different where you live and where I live, but there are people who make a lot of money leveraging, one against the other, right? And ginning up that fear and then selling product, right? That's the vicious cycle. And so the wholeness, I think, is cultivating a sense that there is no separation between you and I, right? We are a collective thing. Like your wellness is my wellness. We all can strive for something better. And again, how to achieve that, which again requires everyone in this room and more.
I delivered babies for about 10 years in Camden, so you get to know families in a really intimate way. So I guess my first thought to that is really, it's when a parent breaks the cycle and whatever they were taught inadvertently, racism, intolerance, anger, violence, they break the cycle and don't pass it on to their kid. And then healing's really been achieved. It's such a good question.
I like your answer better than mine, but I feel like I have to answer it because that's not what we're doing here. I was actually thinking about like restorative justice. That's restorative practices. That's what the question made me think about. In the domestic violence field, we often talk about how every survivor needs different supports. What healing looks like for them won't look like for the next survivor, right? And one of the things that we try to advocate for is to be able to support that survivor in whatever that looks like for them. So for a long time, right, it was use of the criminal legal system was the place you could go to find that healing justice, whatever justice means. And now we're thinking more expansively about how people heal. What do they need? What do they need from their communities? What do they need from their faith leaders? What do they need from their partners? What do they need, and how can we support them holistically as they move forward?
Thank you for those reflections, and thank you for wrestling with that and coming from it from your various perspectives. I think gave the holistic framework that we're looking for even here. So that's very helpful for us. We're drawing closer, but I did want to give opportunity once again for those who may have questions from the audience to lift up. Brother, I know Waterman, good to see you, my brother.
Good morning, everybody.
Good morning.
My name is Eric Waterman. I am the co-founder and executive director of East Flatbush Village Inc., which is a youth and community development organization with the intent focus of preventing gun violence and gang violence in our community. We stumbled upon this work in our community based off the need because we started out with youth sports and activities, and we realized that there were different traumas and challenges within the household. We would work with the kids for 2 days out of the week, and it was like restarting every day they came back to the practices. And so those traumas really existed, and for 15 years ago, we started doing Occupy the Corner and being out in the streets with God Squad and Pastor Monrose and Pastor Galbraith. We did this work, and we were kind of thrown into it based off of the need of the community. And so we kind of embodied the title of today's session in terms of being a voice for faith and community, that tie. We have been doing it for a long time. The question I have to the panel is, as we've been discussing mental health, what preventative aspects are put in place to prevent gun violence through the lens of mental health? And the reason why I ask that is because even right now, East Flatbush Village is engaged with the Office of Mental Health Services, New York State Office of Mental Health Services, to do a mobile mental health trauma support in that community. Why? Because you mentioned some of those social determinants of health, being able to bring people to resources as opposed to trying to reach out to them. Most people won't step forward in their trauma and say, "Hey, I'm traumatized. I feel this way." They actually hide within that trauma, and then it gets worse. And outside of going to the pastor and maybe some other trusted members in the community, what are some of those preventative measures that are being placed in that regard? And I ask that in the lens that we're the first responders a lot of the times in our community, both on the mental health side and of course in traumatic violent situations such as shootings, in which the community calls us first, and we're there when in response. And so I just wanted to bring that question forward in regards to the mental health.
Well, I'll let the doctor speak to the meat of it, but the thing we know for sure is that whether it's a mental health crisis or any other kind of crisis, access to the firearm makes all the difference, right? If you're in suicidal crisis, if you're considering self-harm, suicide attempts involving a firearm are result in death about 90% of the time, as opposed to almost the inverse for every other methodology. And folks who attempt suicide and survive almost never, again, 90% of the time or so, don't go on to die by suicide. They get a second chance, right? They get help, they get support, and they don't end up taking their own lives. You don't get a second chance when there's firearms. So for us, apart from, again, there's underlying causes, and the doctors can speak more to that than I can, the issue is access prevention, right? So what does that look like? That looks like secure storage in your home, right? Making sure your firearms are locked, unloaded when they're not in your possession, when you're not carrying them, regardless of who's in your home. Many states' laws focus just on children, right? If you have a child in the home, there's certain consequences. New York does better than that now, and that's been work. That law's been expanded in recent years. And again, I think most responsible gun owners agree, right? Nobody wants their guns in the hands of someone who shouldn't have them, let alone children. So secure storage, thinking about things like red flag laws, right? Or both the extreme risk protection order, which is a temporary order that prohibits access to firearms and prohibits the purchase of new firearms. So if you or someone you love is in a crisis, there's another step you can take to make sure they can't walk into a gun store and buy a firearm or they are considering harm to themselves or someone else. That's the law in New York State now, and has been since 2018. It's a law in 19 states and soon to be 21 when Michigan and Minnesota become law in the coming weeks. So there are those types of interventions, right? And those are literally just about access prevention. They're vitally important, and making sure that people understand the importance of secure storage, the importance of keeping unauthorized access, preventing unauthorized access to firearms is vital in those moments.
And I'm going to leave it to the doctors who are doing actual work in New York to go to the question. But am I correct that the Bipartisan Safer Communities Act had a lot of funding for schools for mental health?
That was one of the features, yeah. I mean, it created a pretty robust set of crisis intervention funding streams, which is fantastic. So again, for states like New York that have extreme risk laws or are taking other steps, whether it's protecting victims of domestic violence, there are huge pots of money available for organizations. Some of them have to be statewide, and there's processes that people who know more about it than I do can help organizations here tap into. But that was one of the great breakthroughs. Again, we don't get a lot of federal legislation on this, but we did last year, and that was one of the really important features.
The perpetrators and probably majority of the victims of gun violence are men, right? Not women. Like women, may shoot guns, but they don't shoot people with guns. And they are being shot in domestic violence, but the people shooting them are men. So we got a guy problem here. And guys don't want to talk about their feelings, and there's an incredible stigma for everyone for mental health that's lifting, but really for guys. And so how do we norm talking about your mental state, how you're feeling, your anger, how you're working through that? How do we norm amongst guys seeking mental health? Like I think that sort of gets a little bit to the heart of that's the first thing that comes to mind in your question. And I don't hesitate to put on my calendar at work, doctor appointment Thursday, I don't put, my therapy appointment on there. And I don't mention, to people, oh, I'm going to be up, at 4:00 because I have a therapy appointment. I may say, oh, I'm leaving early today for a doctor appointment. So there's just so many ways in which guys are not comfortable talking about this stuff. And we could go a long way as leaders of organizations norming talking about it. So in my prior organization, I talked about it publicly a few times with staff, like, oh, I have a therapy appointment, or I'm going to get therapy. And that was very uncomfortable. I mean, I'm a family doc. I talk about, what your poop looks like every day. I'm used to talking about uncomfortable stuff. That was really uncomfortable. So, I think we need to norm this as leaders and talk about it with our staff and our family members and our friends and our guy friends, and hopefully that concentric circles come out from that.
Prevention is different at different stages, and you alluded to that as well. Prevention for a young person, and particularly males, is going to be very different from that of somebody who may identify as female. Biologically, look in the emergency department. Most of the people come in with injuries. This is from the adult males to the adults to the teenagers to the little kids. The majority of injuries I see are males. They have a lot of energy. It's the father of a 2-year-old. My son is athletically gifted in climbing, running, anything. As somebody who, had I been born in a different era, I probably would have been diagnosed with ADHD. But I had a mother who was a teacher, and we modified a lot of things in the home environment. Athletics, sports, movement. Most schools are not designed for males. They're designed for kids to sit still and to follow directions. But if you have a kid, and for all those of us in this room who are athletes, you have to move. And so it's repressive to keep somebody confined in a specific space and not be able to release certain amounts of energy, or at least just the form of processing. For people who may be considered neurodivergent, or people who just have experienced trauma, the body, was it Vanderkelk? The body keeps the score. I forgot I think that's the name of the book. Is Vanderkelk? Okay, thank you. your body holds on to a lot of stuff, and so there has to be a release. The body itself likes to be in a state of homeostasis or some sort of balance, and if you're not able to dissipate certain things, it's going to wind up exploding. And it starts off in elementary school when you have the very active boys and some girls who feel the need to move and they can't. So what do? You restrict their form of play. You can't go outside to play, which just creates a lot of other anxiety in that kid. So then that kid goes back home. And what do you do when you live in New York City and you don't have places to go and you're confined to an apartment and live in a neighborhood where there's a lot of violence in the community? You explode in the home. And as the son of a black mother and black father, you do certain things in the house that you're not supposed to do. There are physical consequences of that, which creates additional trauma. And so now you're getting in trouble at school for not sitting still. You're getting in trouble at home for not sitting still. And what's being done to dissipate these feelings that you have inside of you? And so the preventative part is really cultivating safe spaces for people to move. And movement can be just the relinquishing of moving a stagnated trauma that you have occupying, that you've compartmentalized in your brain, to the physical movement itself. But either way, we're talking about movement in supportive spaces and supportive environments. So I'm always going to be an advocate for movement and safe spaces and athletics. Combined with mental health services, because we don't want you to just move around as I just got all this energy. No, there needs to be somebody to help tailor and to process it. So that can come in the form of coaching, that can come in the form of counseling. Many of us who do in this room who have been doing violence intervention recognize that our outreach workers and people who are on the streets, they're gifted individuals in mediation without any formalized training. But once we started incorporating mental health first aid and having an understanding of expanding the knowledge and expanding the vocabulary to articulate that some of our patients, these aren't bad people, but they're experiencing specific things, and there's a name to that. Now all of a sudden, there's a different kind of power. So having coaches in these spaces of movement who have an understanding of mental health issues or mental health concerns and challenges is a real major gateway to catapulting large-scale preventative measures within our communities.
I see that question. Just want to add onto that as well. Pastor Monrose and I actually teach a seminary class together this semester, and in the class we had a particular class where we invited the director for the mayor's office of mental health to come into the class to speak to the seminarians in regards to what does this look like? How do we normalize this in our conversation? I know in many other faith traditions, it's welcomed. In my faith tradition and other faith traditions like mine, sometimes there's some hesitancy and some skepticism, and so creating those spaces even from an educational space to see how this can be a conversation among those who are faith leaders, and then it can be communicated honestly and openly to the congregation and to those who we're serving as well. I saw another hand up here. I think we have two more questions, and we're going to have to conclude. Is that right, Rabbi?
Yeah.
I think my mouth is out. Coming from a perspective of a new person in this type of work, meaning that I was that engineer, coming from an engineer, MS in industrial engineering, background in transportation, and just sort of like getting thrown into the work. Our mindset as engineers is so systematic, floor plans, layouts, and timeline, but none of that is working. And what I'm finding out, I am very active in my community. My ministry is called War Cry for Our Children, and I'm that person that's actually getting information from the actual people in the community. And one of the alarming facts that I've worked up stats on is that a lot of our young people, when they're being incarcerated, there's some type of mental illness that's occurring in there. And then when they're returned back to the streets, they can't deal with life. And so one of the things I wanted to know is that, is there any way that they could be tested for mental illness and worked with in mental illness? Because yes, you know, just like with people on drugs, they know how to pretend and fake like nothing is happening when there's a lot of things happening. And in the Black household, we are always told what happens in here does what? stays in here. So if we got a crazy uncle or somebody doing, we keep it in there. So there's a lot of distrust that between the police and the health practitioners that we have. So we've got to have people that are on the ground. I mean, I know it's good, but we need to get the money to the urban areas, train the people on the ground so we can turn this whole thing around. How can we do that?
Thank you for your comment. And quick question: where are you located?
In Queens.
In Queens? Okay. There's some people in Queens that may be of assistance. I work for the New York City Health and Hospitals Corporation. Kings County Hospital is one of those major institutions. Queens Hospital Center out in Jamaica is another one. Jamaica Hospital isn't a part of that, but these are all places that have high amounts of trauma and do have behavioral health services. So Queens Hospital Center does have access to behavioral health services. Elmhurst Hospital is the larger, as well as probably one of the the largest public hospital in Queens. They also have major comprehensive mental health services. That's over in East Elmhurst, right by not too far from Roosevelt and Jackson Heights. So that may be a conduit to bring somebody in there if they need to be tested in a way if they're not able to get access to some of the other programs. I'm sure our good doctor is going to mention, Dr. Jeff, is Jeff, right? Dr. Jeff is going to mention, I'm sure, because I see he's looking at me. There's one thing that I don't want you to give up on. I don't want you to give up on your background and the things that you've come from. Healthcare itself, we look at it as a medical problem sometimes, but it's really a systems problem. And the systems problem is looking at how do we deliver these things into different components at different points of time. Many physicians don't think like that at all. Many nurses don't think like that. Our ER techs, and so it's the engineers who help orchestrate and figure out how do we improve the quality and flow to make sure it gets to the people who are most vulnerable. So don't lose that at all. Now, the problem that many of us have from community-based organizations are the resources that allow us to fix the systems. And so I think that's something that I think maybe we as a collective group in here may be able to help you with. Our organization, CAVI, does do trainings for people who are doing violence prevention and intervention. There's a mental health first aid. There's a whole cadre of people within the cure violence space that are also helping do trainings. There's an organization called the HAVI, HAVI.org, and HAVI is the Healing Alliance for Violence Intervention. They're formerly known as the National Network for Hospital-Based Violence Intervention Programs. But H is in Harry, A is in Apple, V is in Victor, and I is in Igloo.org. They are a major resource for people who are doing this stuff, who have been doing it for a while, and people who are starting out. There's specific protocols that they've been developing that all of our respective intervention programs are starting to use nationwide, because that, from a policy point of view, you can collect the same data sets, which help drive change. We can use our regular collective narratives and even use qualitative analysis, but we want to make sure that we can quantitate those studies and these data sets that can push policies and agendas and even augment larger amounts of funding so that we can continue to do this work more purposefully. And once we finish doing this work, we can move on to the next places that are highly vulnerable.
Can I ask one question?
Yeah, sure. There's the mic.
I don't know if this is fair enough, but for those in this room who do advocacy and meet with electeds, I don't know if each of you in one word could tell us what you view is, apart from changing laws, regulations, closing loopholes, pipeline, etc., in terms of funding streams. Is there one single area that you can recommend that could help, the number one priority, help change, reduce gun violence, if each of you could comment? And I know it's multiples and it goes across the board, and everybody can say mental illness, but I know, Jeff, you've mentioned police departments. Is there one each of you could mention as the number one priority? Thank you.
New York has, so in many states, police officers are either licensed or certified by their state. And if they lose that certification, they can't work. So even if they have a poorly run police department, that doesn't terminate them. They'll lose their ability to work. So New York actually has very lax laws about its certification process. If you're an entry-level staff member for my organization who make $18, $19, $20, $21 an hour, you have to get fingerprinted and filed and all this stuff with something called the Justice Center. If you ever commit a neglectful or abusive act against someone with intellectual and developmental delay, you're banned from the field the rest of your life. That's not true for police officers. You can go from department to department because the state certification process in New York is pretty lacking. So I would do something that wouldn't cost any money, which is up the accountability of police officers by taking away their certification if they misbehave, and they'll behave better. Trying to do this department by department isn't going to work.
Well, I have two. One, the debt limit discussion is pretty crazy. Going back to fiscal year 2022 would impact all of the things that we're talking about here that impact the social determinants of health and violence. But if there was one like funding stream, I would say community violence intervention. Like it has gotten a lot of interest, and there is bipartisan support a lot because of like the data sets and the research that's been done about the effectiveness of that community work. So at the federal level, there has been pretty large appropriations that also exist at the state and local levels as well.
I'll cheat a little. Not because I'm a lawyer, but that's how it works. I would say, again, you need a whole of government response, right? You need coordination. That's the theme of the day, right? You need the left hand to know what the right hand is doing. So I would, when I think states like New York that have set up an Office of Gun Violence Prevention, that can become like the hub of the wheel, right? That has real entry points to law enforcement, to state government, to the governor's offices, to these community groups, can then turn around and give that funding out as direct grants, can then give out support in the form of TA, technical assistance, or other kinds of resourcing. Because again, these organizations are not huge by and large. They're not always, they're badly insufficiently resourced, but they don't have the infrastructure often to continue the life-saving work well and robustly in places where they are doing it now. So I think if there's a way to channel into, I think you get the ancillary benefit of statewide coordination, right? Because state laws matter, local laws matter. Law enforcement upstate, downstate, elsewhere has to be aligned. You have to have clear processes and clear understanding of what the law is and how it's being enforced. And I think if you can put resources into that kind of whole of government response, that's your best bet.
Two things. One, start, so people have an interest in their thinking and going over these ideas in their head. You just have to start, do the work. Start with a small cohort and grow from that. You're constantly, I was in my head with the organization and the work we're doing for at least 6 years because we were getting pushed back and didn't have funding. It wasn't until we started doing the work that we started making a difference. And then eventually funding came a few years later. So you just have to start and be willing to fail and go back to the drawing board. And the second is for people who are funders, you have to fund both the small grassroots as well as the larger scale organizations. The work that we do in our respective hospitals would not be possible. You have the larger institution as the hospital entity, but if it weren't for the small community-based organizations and the small grassroots who have an intimate knowledge of the people in the community, this stuff wasn't making a major dent, which is why groups like the 67th Clergy Council have been a major force because they had access to people that the hospitals weren't connecting to, which is why people, Eric and Monique, I've known Eric Waterman and Monique Waterman for a long time because I remember when everybody was starting off and nobody was paying us any attention. And we were like yelling, yo, come help us. We know these kids. We know where they live. They knock on our doors. They ring our doorbells. We need some funding. And people are like, yo, great idea. Sorry, there's no money. and so you wind up working inefficiently because you don't have the financial capacity to do that. So as a funder, pay attention to the larger organizations and pay attention to the small grassroots organizations that have a lot of promise because those are definitely gems that are there. They're going to be highly effective.
Thank you for that. And also, you also preempted me. I wanted to give a shout out in regards to faith. Knowing those who are doing this work, connecting with them, and partnering strategically. That's how I first met our now Assembly member Monique Chandler Waterman, who's here with us today, who's also a member of our congregation in regards to just doing that work in the context of the community. Our time has come to an end, but can we put our hands together for this august panel? Thank you once again, and turn it over to.
So one more round of applause.
Yeah.
I just want to tell you something. When we started this journey, and I know Emily and Rabbi Creditor, it was sort of like, what do we get? What do we get? Wow. You know, wow. Not only did we get, we're getting. And we're getting to where we need to be. So one of the next steps, of course, is lunch. That's important. Is to on your journey, you got to sustain yourself, right? You got to have a little energy. You got to have a little fuel for the journey. So we're going to ask you to step out. If there's box lunches, come back in. Talk amongst one another. Wait. I'm talking about clergy people. I'm too. That's one. So I want you to go in a minute. We'll set you out there and get lunch. Bring it back in. Talk amongst one another. We're going to cut it down a little bit because we started a little bit late. We're going to hear from the assembly person during lunch, and the assembly person helped us to found, before she became the assembly person from the area, she helped us to found the Brooklyn Coalition on Healthcare Disparities in Brooklyn. Talk about being holistic, about how you approach these things, is being holistic. And I want you to talk amongst each other. I'm going to leave you a question. I'm going to leave you a question to talk amongst. You'll find what they're talking about. Take the word for it. You'll talk about sandwiches. You'll talk about something. My question is how do we get out of a space where people think guns are a problem-solving device? That's what I want you to. How do we get out of this space where we think that a problem-solving device is a gun? And we got to find other problem-solving devices. So enjoy lunch. I'll see you all in a little bit.
All right, what's up, guys? This is Chris here. So, lunchtime for the facing the gun violence epidemic, the Voices of Faith and Community conference inside the UJA headquarters on 59th Street. So I've been here for 3 hours. It's good. It's probably another 3 hours, another 4 hours to be exact. Here to stay for the whole panel, and that's it. But everybody out here should be able to attend this panel 3 o'clock if y'all can. 3 o'clock. Jordan Neely's vigil or a tribute at the station is at 3 o'clock. The Uptown F level at Broadway and Broadway Lafayette Station, where he unfortunately passed away. I can't show up. I'm attending this for this panel for the whole day, so I can't attend. I wish I could, but I'll be there to support his spirit. And it's sad that it happened to that man. It shouldn't happen to that man at all. So rest in peace to Jordan Neely. R.I.P. to the man. It shouldn't happen. I don't care if the man lashed off. He didn't have to die. I understand, you could have choked the guy, but he didn't have to die. So that's my thoughts about Jordan Neely. That's my thoughts right now about Jordan Neely. You know what I mean? I'm going live, and the reason I'm going live because I'm talking about right now. So people are like, well, you don't care. I do care. I really care about the guy. I mean, I just can't show up to the event because I'm here supporting this all day from 9 o'clock to 4 p.m. on 59th Street on the 7th floor. So people in 2020, I mean, if y'all could show up down there, please show up. Please come out there and support. It's just horrible that it happened to that man. And I pray it happened to nobody. Like I said, people have mental breakdowns all the time with Jordan Neely. People have mental breakdowns all the time. But nobody nobody should die because they lashed off. It's a way you can handle a person, but they didn't have to die. He may have to die. He's still a human being. I mean, people have episodes all the time, but we're all human. We're all human. And that's what I'm here to say. I know my phone about to die 5%. I'm just gonna talk it. I gotta get some food because Monique Channel Ward, the state assembly member, she represents the 58th district. I helped her get into city state assembly because I didn't want the other guy, Hercules Reed, to get in because that dude will ruin that district for the developers. But going back to this, she's always speaking of you for lunch, and and that's the thing. So I'm gonna get some food right now. I'm gonna go get some food while we're here. I'm gonna try to do this for this thing just die. I might go with my other phone, and let's see what they got here. Let's go back. Let's go right here. My phone is 5%. So you have ice. So what they have here. You have cookies. You have, let me see, falafel, shredded lettuce, tomato sauce, tuna salad, herb roasted vegetables. There's a lot of takeaway food. Grilled chicken, lettuce, smoked turkey, chickpea spread. I'm not a fan of that, but this is some good. They made a lot of good food here. Falafel, shredded lettuce. Let me see, tuna salad, herb roasted vegetables, chickpea, grilled chicken, lettuce, smoked turkey. So I might get the smoked turkey. I mean,
a lot of decision to make.
yeah, it's a lot of decisions, right? A lot of food. So you see the history of the organization here, of the JCRC. There's a lot of history here. A lot of history. It's a lot of history of the organization. You got coffee, you got etc. Water. So you got enough food for everybody here. I'm just going to get some food. I might go get some drinks and then get some food. Tuna salad, falafel. I see you get a smoked turkey. Sorry about that. Grilled chicken, lettuce. Smoked tomato, roasted tomato, avocado. So take this. So I did this food, right? Grilled chicken. All right, let's take this instead. And you got Coca-Cola here before Monique starts talking. She's gonna be speaking today at a few to actually get some food. So you got the drinks here. It's okay. Yeah. Got the Coca-Cola. I gotta let it sit down for a while before it goes away. I gotta get a fork. So got a fork. Yeah, you get a fork and a cookie. You get this nice chocolate chip cookie. So who I decide to eat this, and then hopefully soon that Gideon Taylor here. Hopefully soon starts. So about to log off. Let's open before we log off. Let me see if the app open. I gotta sit down before it blows in my face. This it's now. So this is nice food, guys. Real beautiful food. Grilled chicken, smoked turkey, and etc. And Gideon Taylor right there. Coca-Cola, turkey, and that's it. A lot of people over here. God Squad, Monique, Cheddar Waterman. Good. So I gotta eat. Hungry. So take care, guys. See you later.